I'm going to call our meeting to order. It is 5:45 on August 11th, 2020, and I'm going to ask everyone to please stand for the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, and thank you very much for being here tonight. I'm just going to remind everybody to please silence your cell phones. That includes the board members sitting up here. To try and keep conversations to a quiet minimum in the audience. So thank you very much. And Mr. Barber, you can start us off with Rise Up SDMC.
Okay. Thank you very much, Madam Chair, board members, Superintendent. I have to say it's tremendous to be back here tonight, and it's been a long time since we've been able to come in here and meet with you all personally, but the thing that I'm most thankful for is it gives us an opportunity really again to recognize and see some of the amazing work that's done by our students and staff, and that's how we're going to start tonight's proceeding off. And I'll introduce these gentlemen here in just a moment, but I did want to say that I think it's especially important and expedient that we're starting tonight's board meeting off with a music video done by a collection of students across the school district and from a number of different schools, and they collaborated this summer on this project together. So we're going to get to witness their talents. And the reason I bring that up is because during the day today, we noticed a lot of conversation on social media stating that the school district was cutting or eliminating music and art programs in the district. And I just want to say that that is not true. We are not doing that. What we are doing, just like everything else during this COVID situation, is we're having to make adjustments. All of our schools will continue to have music classes. They just won't look like the music classes that we've had in the past. And the reason they will look different and be different, to my understanding, is because of the health and safety reasons. We just don't have the ability to bring 40 students into a band room or a chorus room and have them sharing instruments and singing together in those spots. So like I said, our music and our arts classes will look different this year, but they will continue. And we have a proud tradition. I'm standing here right now with the director of bands for Braden River High School. You know him well because he's here almost every single year. It's Jeremiah Bowman. His band, his marching band, has won the state championship in the state of Florida 3 consecutive years in a row. Based on what we've been experiencing today, I just don't think it's an accident that he's here. So we certainly appreciate the fact that he's here. And I want to just tell you a little bit about this project. It's called Rise Up SDMC, and I want to let you know that there were 12 schools involved in this. Those schools were Bayshore High School, Braden River High School, Horizons Academy, Lakewood Ranch High, Manatee High, Palmetto High, Parish Community High, Southeast High, Hale Middle, Nolan Middle, and Rowlett Middle School, and Johnson K through 8. So with that, I'm going to bring forward Mr. Bowman, and he's going to tell us a little bit about how all this came about.
Thank you very much, Mr. Barber, Board Chair, Mrs. Messenger, school board members, and Superintendent Saunders for the invitation to be here this evening and introduce this production. Before I introduce the video, I'd like to acknowledge and thank Ms. Julie Hebert, our Visual and Performing Arts Curriculum Specialist, for her support and dedication to this project. She was essential, and unfortunately can't be with us tonight, to coordinate district efforts to bring this project to fruition. I would like to thank the Manatee Arts Education Council for financially supporting this project. And I would like to thank Mr. Daniel Sipes, who was critical to our success. This is Daniel Sipes. Daniel is a 2020 graduate of Braden River High School. Daniel plans to attend Southeastern University in Lakeland, Florida, and major in practical ministries and minor in film. Daniel was responsible for the video editing and production. Without his help, we would have not been able to pull off this project with such success. So thank you very much, Daniel.
Thanks for letting me be a part of it. It was a lot of fun. I've always enjoyed when we do collaborations with different arts sides of school, so I liked it. It was very fun for me. Thank you.
Thank you very much, Daniel. So about this production, which we have entitled SDMC Rise Up, is a collaboration of the best of the performing and visual arts in Manatee County. The chorus of Rise Up, I believe, gives us the best summary I can of the spirit of this project and the 22 teachers and 70 students who participated. The chorus goes, "And I'll rise up, I'll rise like the day, I'll rise up, I'll rise unafraid, I'll rise up, and I'll do it 1,000 times again." The students, faculty, and staff of Manatee County did rise up during that final quarter of the last school year, and they are about to rise up again as we enter the 2020 school year. The video not only demonstrates the strength of our students, faculty, and staff, but it also showcases the critical importance of the arts in our schools. We must have instrumental music, chorus, art, and dance, and theater to survive this pandemic. And it is vital, and we can do it safely. Thankfully, Mrs. Scarborough and her team have worked incredibly hard to keep music going at Braden River High. And working with these students this summer, I can tell you that these students are committed to making music work in our schools. And we should meet their desire to keep creating art with our absolute best efforts. I am proud to present, featuring the student musicians, dancers, and artists of Manatee County, SDMC Rise Up.
Broken down and tired of living life on the merry-go-round, and you can't find the fighter, but I see it in you, so we gon' walk it out. We gon' walk it out.
you.
Thank you, everybody.
Thank you.
Thank you.
Well, it's great to see our students back in action, huh?
Madam Chair, the young man Sipes is my next door neighbor.
Small world.
Yeah, it is. Oh my goodness, that's amazing.
You didn't know you were living next to somebody famous.
Well, I know he can cut grass. I know that.
Okay.
Yeah, I know he can do that. So,
All right, board members, it's my privilege to give you a little presentation on a really unique and we hope beneficial community initiative that really started coming together 1 month ago. A month ago, Superintendent Saunders initiated a virtual meeting that included Dr. Jennifer Bency of the Florida Health Department of Manatee County, Sherry Courier, the Manatee County Government Administrator, and other leaders across the community to come together and have a virtual discussion of what steps we might be able to take to help stop the spread of COVID-19. The thing that really was part of the conversation that day is what can we do together as a community? And they sort of tasked us, the staff of the various agencies, especially the Florida Department of Health, the school district, and the county government, the communication teams of those organizations, to go back and come up with the basics of a plan and come back and present it to them. And so that's what we did. The plan that we presented the next week that was approved by the leaders of those organizations and others that I'll tell you more about in a moment is called the Mask Up Manatee Coalition. It's a group of organizations whose mission is to come together, the leaders of these organizations and the employees of these organizations, and to gather behind one position of saying we have to work together to make a difference against COVID-19. Since last March, all of these organizations have been practicing the prevention tips provided by the CDC and the Florida Department of Health, but we've been doing it in our own organizations in silos. We haven't been sharing that message together. So the decision was made by Superintendent Saunders and the other leaders of these organizations that it was time for Manatee County to come together and do something as a community, and that the leaders should step forward and speak with one clear, loud voice that's Manatee specific. So as soon as we got that charge, we started reaching out to other organizations, and they started responding quite quickly. If you look at this slide here, these are just some of the original members. If you look, we have the 3 major hospitals, Centerstone, we have businesses, we have community nonprofit organizations, and it is just really, at this point, as of today, we have a total of 31 members of this coalition, and it's growing daily. So we are really excited about it. And as Superintendent Saunders has said, the real power of this campaign is in the unity of the message and the unity of the leaders and organizations involved. And we really think that's where the power of this campaign comes from. Excuse me one second. I think, okay. One of the major parts of the campaign is educational initiatives. And while we have a central focus, and that's to encourage residents of Manatee County, across Manatee County, to wear masks when in public, we will also be recognizing and stressing other important preventative measures. And one of the important parts of that is reaching out to the youth and getting them to understand the message that we have. And what we're going to do is we're going to pass out some cards to you that were created for this campaign.
Thank you.
And as you'll see, these cards are done in both English and Spanish. And we will be passing this out to our students as well as members of the community as we go around and as this campaign continues to grow and spread. And as Dr. Bensi has said, the only way to protect ourselves and each other from spreading this deadly virus in the absence of a vaccine is to take preventative action. Mask Up Manatee brings this message home. And again, that's a major part of what we're doing. In addition to educational initiatives, we are also going to use the power of all our different organizations to promote these messages on social media. If you look up here and you see these flyers, they are made for social media purposes. They can be used as flyers and posters in our schools or in the different organizations that are involved. Once again, in addition to being in English, they will be in Spanish also. One of the coolest things that we have is we can take these posters or the social media images, and we can take the image of the person in the photo out, and we can send them to our schools or partnership coalition members, and they can put faces of people in their own organizations or students at our schools in there and use that as a poster or as a flyer at their school, so that when you look at these messages or you post it on social media, you're seeing people you know. And so we think that's a great way to spread the message. And really, the power of this whole initiative is that when we get together as a collection of 31 different coalition members and we spread this message together on social media, we are hoping that it not only causes people to take notice, but it results in people making a change in what they're doing and wanting to be part of the team. So, we have face mask distribution. If you look at the slide here, we basically have two different masks. The one at the top is for the children's mask. We will have that available, and the one below is the adult mask. And we've actually put in for a shipment of 50,000 of these using CARES Act money. We're working again with the county government and the Florida Department of Health to get these masks. The first shipment will be 5,000 masks that'll be coming in. I believe it's around April 26th. When we get the mask in, we will start. What did I say?
April?
Yes, August 26th. Okay. We're not going to have to wait that long. They're not that backed up. Yeah, August 26th. So when we get those masks in, we are going to distribute them. We're going to have distribution days. And what we're going to do is we're going to take those masks and we're going to put stickers and other kind of, car decals, and we're going to dress up cars from the district, from the county government, and from the Florida Department of Health, and we're going to take these masks into the areas of our community who've had the most impact in COVID-19 cases. We're going to deliver them to community organizations, to other to businesses that may be in those areas, and also to individuals. So again, we want to have an impact in all parts of the community. So we kicked off this campaign last Wednesday at Braden River High School. We had a press conference. It was really led by Superintendent Saunders and the other leaders. We had 12 representatives of the different coalition members there. As you can see, we had a tremendous turnout. We weren't even able to place all the media outlets on there that actually covered it, but we did get really good coverage. So we're very happy with the start that we're off to, and we're still looking for members and people who want to get involved with us and be part of the coalition. They can email us at maskupmanatee@gmail.com, and when we share on social media, we're using the hashtag #MaskUpManatee. These people that are here with me are part of our district communications team. And for years, they've done a tremendous job. These people, Steve's a little bit newer, but the people with MSTV and have been parts of 2 successful referendums. They've won 2 National Public Relations Awards. They've won 2 statewide Public Relations Awards, and they just continue to do great work. So I want to introduce them to you right now. This is Melissa Parker. She's our social media and communications specialist. This is Damon May. He's a graphic designer. He also does work for MTC, and basically the logo and all of the social media things that you're seeing were produced by Damon, and so it's a great thing. Deb Perry Gambino, she's our community engagement specialist. She played a big role in bringing that press conference together, and she just does a lot of different things in relation to this and to everything we do. Stephen Oposki, we're going to show right now the video that he did for this campaign. So MSTV in the back. We have Nick Batchelder and Susan Gilbank. So let's watch this video.
You may be seeing a lot of people wearing masks in Manatee County and wondering why.
I wear a mask to protect my family and friends.
I wear a mask to protect our teachers and healthcare workers.
We wear masks because we care about you.
Coronavirus is a disease that you can have without knowing it. It's also a disease you can spread to friends, family, and others without knowing it. When worn correctly, masks and face coverings worn by people ages 2 and older can help prevent the spread of COVID-19.
Masks are here to help us. People wear them to keep safe and healthy.
We've got you covered. Make sure your mask is over your nose and your mouth.
Underneath my mask, I wear a smile. It's protecting you and me from harmful germs.
Face masks help prevent coronavirus germs from getting into our community and infecting others when you speak, cough, or sneeze. In addition to wearing a mask or cloth face covering, wash your hands frequently. Use hand sanitizer before and after wearing a mask if soap and water isn't available. Face mask coverings should fit snugly against the sides of the face while still allowing you to breathe. Use the ear loops when putting it on and when removing it. Be sure not to touch the mask while you're wearing it. Keep our community beautiful. Please throw away single-use paper masks. Reusable cloth masks should be stored in a paper bag until they're washed each day. Finally, maintain social distancing, at least 6 feet if possible. According to the CDC, coronavirus can still linger in the air even if a person isn't around.
Mask up, Manatee.
Mask up, Manatee.
Mask up, Manatee.
This message is brought to you by the Mask Up Manatee Coalition. Thank you for helping to keep our community safe and healthy.
Really nice.
Thank you. Again, that video was written and filmed and produced by the members of this team, and also the students involved are one of our partners. They're part of the Healthy Teens Coalition, so it's been great to have them. Again, I want to mention the MSTV people in the back, Nick Batchelder and Susan Gilbank. I don't know if Michael Trivoli's back there, but we'll also want to mention Matt Messenger and Linda Lambert because they're all part of this team as well. So thank you very much. If you have any questions, I'll be happy to try and answer them.
Thank you.
All right? Thank you very much.
Okay, we are going to move forward with the approval of the agenda. Before I begin that, I just want to make sure Dr. Hopes can hear us. Dr. Hopes, can you hear us?
Yes, ma'am, I can.
Wonderful. Okay, I just want to make sure everybody can talk. All right. The chair has found good cause to amend the agenda to include all items listed under agenda amendments on the August 11th, 2020 agenda, updated August 10th, 2020, and posted to the district website, manateeschools.net. Do I have a motion?
So moved.
Got a motion? Do I have a second?
Second.
Okay, I've got a motion and a second.
Madam Chair,
Yes, Reverend Golden.
I have an unreadiness.
I'm sorry?
I have an unreadiness.
An unreadiness.
I would like to remove item 23 from the consent agenda,
Item 23 from the consent agenda.
and I would like to have that placed under new business.
Okay, so you'd like to just move it from the consent agenda. You don't want to remove it from the agenda totally. You just would like to pull it and add it to consent items to be discussed.
That is correct.
Okay. Item number 23 is approval of the School District of Manatee County 2020-2021 Master In-Service Plan. Am I understanding you correctly? Is that what you'd like to move?
In my agenda, number 23 is the approval of the School District of Manatee County's Mental Health Assistant Allocation Plan for the district in the amount of $1,733,920.
That is item number 24 on my computer. But either way, now we are on the same page, whatever number it is on your computer or paper. We now understand that what you'd like to move is approval of the School District of Manatee County Mental Health Assistance Allocation Plan. You'd like to move that to new business discussion items pulled from consent.
That is correct.
Okay, we can do that. Is there any further discussion?
Madam Chair?
Vice Chair Kennedy?
Yeah, I'd like to make a motion to amend the agenda to include a motion to rescind the approval of the plan for the reopening of schools for the 2021 school year.
Okay. Is there a second on that? Okay, hearing none. Is there any further discussion on the approval of the agenda?
Now, for discussion purposes, I'll second Mr. Kennedy's motion.
Okay, say their motion again?
Uh,
I can't, I guess you
Motion.
can't have it just for discussion purposes. But
That was not his motion. His motion was not a discussion.
Yeah, this was a motion to amend the agenda to include a motion to rescind the approval of the plan for the reopening of schools for the 2020-21 school year.
I guess I'll refer to our board parliamentarian if that's a proper motion, a motion to rescind a plan.
Yes, Board Member Kennedy can make that motion.
Okay. Are you seconding that motion to add that to the agenda?
I'll second it.
Okay. We have a motion on the table, a motion to rescind the plan, reopening plan. Am I understanding that correctly?
Motion to rescind the approval of the plan.
Approval. Motion to rescind the approval.
Madam Chair,
Yes.
I have a technical question about that.
Yes.
Mr. Kennedy and I were the two votes nay
Yes.
on that. And I'm not can the nay votes, bring it back? That's my issue.
That's why I referred to our parliamentarian, because I have that same concern. However, that's why I referred to him to better answer that.
Chair.
Yes, Dr. Hopes?
I have to look it up, but I'm not so sure that you can rescind a motion that's already been acted upon.
I also agree with you on that. That's why I referred to our board parliamentarian to give us feedback on that, to better advise us. Mr. Dyke, can you come speak before the microphone?
Happy to. Thank you, Madam Chair.
Yeah.
Yes, there's a little bit of confusion, but a motion to rescind can be brought by any one of the members.
Mhm.
And that's a motion to rescind an action that's already been approved. So it does not require a member that was a person that voted in favor. Anybody can make that motion. It has some restrictions to it. It's harder to pass than a typical motion. There's a requirement under Roberts that it be noticed at the previous meeting, or that it be included in the call to meeting of the meeting where it's brought up. And if it does not meet those two requirements, it requires in the vote a supermajority to approve it, not just a simple majority. In addition, if action has already been taken by the body based on the earlier motion that passed, then that cannot be undone, action that's already been relied upon. And probably the superintendent may need to report if the district's taken actions based on the plan that was passed previously.
Madam Superintendent, can you give us some more information on that?
I'm not exactly sure I understand the question. I will tell you that our reopening plan was approved by the Department of Education, and it was to go into effect where we began our reopening of the school year effective August 3rd when teachers return for the 2021 school year, and our students return on the 17th. We have begun the process. I'm not sure if that's what you're asking, but we have enacted and are functioning under the reopening plan, because until that was board approved and then approved by the state, none of our employees for the 2021 school year had returned in operations of brick and mortar work, etc. So
just so that I completely understand, this motion to rescind would have to mean that this has already taken place, but it sounds as if it already has. Am I understanding you correctly?
Madam Chair?
Dr. Hopes?
Yes, ma'am. I can attest, the superintendent and I visited schools today. I visited 2 schools this morning, and I can attest firsthand that the motion that was passed to submit our reopening plan with the aforementioned dates have definitely been acted upon. Schools have taken all the necessary preparations and actions to fully open our district on the 17th. So it would be my position, seeing firsthand with the superintendent, that indeed the motion that was passed at the prior meeting has been acted upon to the fullest extent, with the exception of the children being delivered by school bus. Thank you, Madam Chair.
Thank you. According to our bylaws, you are our board parliamentarian, so I'm relying on you to say whether this motion is a proper motion or it is not.
I feel the motion's proper. As I mentioned, it requires a supermajority to pass, which would be 4 out of the 5. And I believe hearing from your staff if actions have been taken in reliance upon what you're being asked to rescind, it's up to you with that knowledge to influence how you vote.
But we don't need a supermajority to add it to the agenda, just when the vote comes to be called, correct?
Yes, to add it to the agenda.
Okay. Okay. Wonderful. Okay, so we have.
Chair,
Yes,
I
Reverend
have a
Golden.
question, because I think I've heard 2 different things. First, I heard you say that in order for the motion to be considered, it could not be considered with respect to any actions that have been taken based on the motion that is sought to be rescinded. Is that right?
You cannot rescind actions that have already been taken.
That's not what I asked you. I thought you read that in order for a motion to rescind to be entertained, it could not be entertained with respect to a previous motion that has been acted upon. Is that correct?
It's a little more complex when you have a plan that has multiple actions. So if there's actions that have not occurred yet, those could be rescinded.
I'm sorry, I didn't hear you.
Actions that have not occurred yet can be rescinded,
Okay.
but not actions that have already occurred in reliance upon the previous action board motion that passed.
Sir, that's what I'm asking you about, because the superintendent and one of the board members have stated publicly that the previous action that we took has been acted upon. Indeed, I heard him say he went to 2 schools today with the superintendent. So I'll phrase it another way. Are those actions sufficient to preclude a consideration of rescinding the motion upon which they were based and which was passed by this board?
If the staff has acted on the motion that passed and has taken all of the actions necessary to carry out that previous motion that passed, then I would say this new motion would not be appropriate.
Okay. So what we approved at a previous meeting was the authorization of the superintendent to submit a plan to the Department of Education. And I believe that that plan has been submitted and that that plan has been approved. And that, well, this is so embarrassing.
Look what you did.
Okay. Do I have to put $5 in a kitty or something like that?
$5 to the education
in the education foundation. Shut up. Oh, no, I can't answer. So it'll stop in a second. Can you stop that? I don't want to tear it up because then I'd have to pay for it. Okay. So what has happened is that we approved the superintendent submitting a plan to the Department of Education, and I'm given to understand that that plan has been approved by the State Department of Education, and that in fact actions have been taken in this district in reliance on that plan. So my question to you is, are those sufficient actions to prevent at this time a proper motion to rescind the motion that we took to approve the plan? Because the actions necessary for the plan to be executed are going to be ongoing for the whole year. This is a plan for the year. And so we could have this motion come up every meeting to rescind that particular, well, no, there was another part that you said that you have to bring it up within a meeting or so. So that's my question to you. And I'm not trying to put you on the spot here, and I don't want to belabor this, but I think it's very important that we do this right as opposed to continuing to do it over and over again. The people deserve better than that.
And a simple example would be if the board authorized to paint a building and the building got painted, you cannot bring that motion back up again.
To rescind it.
To rescind it after the building's painted. So the actions that
district has taken based on the approval of the plan, may I ask the superintendent, in reliance upon that, has everything taken place that needed to take place to get the plan approved by the state?
The plan has been approved by the state, and it has been executed and has started effective August 3rd. It was approved by the state before that. I guess you could say it hadn't been acted upon if no one had begun the 2021 school year. We did begin the 2021 school year August 3rd. You know. So I don't
Madam Chair?
know what that means.
Dr. Hopes?
Yes, I can give you more clarification. I think this is what Councilor Dye was referring to. And the specific opinion, the written, is that if the original motion has been acted upon and that action cannot be undone, the motion cannot be rescinded. However, any unexecuted part could be rescinded or amended. So I think what I think Mr. Dye was trying to say is if there are portions of that motion that have not been acted on, i.e. children being delivered to school on the first day, that indeed it could be rescinded or amended, but it would require that supermajority vote.
Okay. Vice Chair Kennedy, I see that you have signed to speak.
I did, thank you. I agree with what what Dr. Hopes just said, and Superintendent Saunders just hit on a point I was going to make. And board members, you know exactly what I'm after. It's the idea I've already brought up with you a couple times. I just want to do the first couple weeks a little bit differently. That 2 weeks of e-learning, and then we start on August 31st with our modalities, or maybe with some of the things going on, we changed our modalities, maybe it's secondary, but because that part has not been executed. And the motion I'm asking to rescind is approval of the plan for reopening. I'm not attempting to rescind the entire thing, just that first 2 weeks of the school year. Through the entire month of July and really into June, we were talking about this plan may change, we may need to resubmit, we may need to reassess. So that's where I'm coming from with this. I know this is a high barrier because it is a supermajority. And also, I'll stop myself because it just dawned on me that we are actually into the merits of this motion when what we should be talking about is the motion to amend the agenda.
I 100% agree with you. That's why we'll just vote, and we're on to approval of amending the agenda to add the item of a motion to rescind the reopening plans for the 2020-21 school year. Am I stating that correctly?
Yeah, to go back to July 14th, the title was approval of the plan for reopening of schools for the 2021 school year.
Okay.
Now, this is not the approval of the agenda, but the approval of the motion to add this matter to the agenda.
Yes, sir. It is only to add this item or not. Okay. So we've had a motion and a second. I think we've discussed it fully, probably more so than I agree than we needed to at this point. All those in favor, please signify by saying aye.
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 All those opposed?
Aye.
Nay.
Nay.
Okay.
It fails. 2-3. With Vice Chair Kennedy and Mr. Minor voting in the affirmative, Reverend Golden, myself, and Dr. Hopes voting against. And moving forward with the agenda,
Excuse me, Madam.
Yes.
The vote to amend the agenda is a simple majority.
Yes, it failed.
Okay, sorry.
It didn't have to be a supermajority. I agree with you. It only had to be a supermajority when we got to that item, but we did not get to that item.
Okay.
It will not be added.
Misunderstood. Sorry.
Thank you very much. So we are back on the approval of the agenda as it has already been amended from Reverend Golden's request. Is there any further discussion? Hearing none, we will move forward with the vote. It's been motioned and seconded. All those in favor of the approval of the agenda, please signify by saying aye.
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 Any opposed? Okay, that passes unanimously. Let's move forward to reports and presentations. It looks as if Mr. Chapman, you're up first.
Well, and we have Sean Foster and Sam Wagner from Sunrise Consulting Group,
Oh, wonderful.
who's going to do our legislative lobbyists. And let me pull up their presentation. Hopefully this is it. Sean and Sam, are you?
We're here.
Hey, there you guys are.
We're going to do it live, Kevin.
All right. Modern technology, here we go. I have the presentation on the computer. Do I need to Teams it, Michelle, or is Nick doing that in the back? Here we go. Okay.
There you go.
And let me, because just so Dr. Hopes can see. All right. Go ahead, guys.
Again, good afternoon, and thank you for letting us participate. And Sam and I just want to say, I'll tell you this real quick. I tested positive for COVID 2 weeks ago. Sam is also positive. My wife became positive also, and Sam's fiance. So we absolutely understand the burden and the conversations that you all are having and having to take moving forward with your school system. And I know it's a very sensitive project, but we're praying for you all, and we appreciated the opportunity to represent you all. And at this time, we'll go ahead and start on the slides. Thank you, Kevin.
Okay.
So what we really wanted to do real quick was just give you the 50,000 foot level. Obviously, we're around year-round with you all, working with your superintendent and Kevin. It starts quite intensely during the committee weeks. We attend all the Florida School Board Association and the Florida Educational Legislative Liaisons, and also the superintendent's meetings that they have in Tallahassee. And we make sure that we're a liaison getting the information to you and your members on the board. We participated obviously throughout the committee weeks and session, and we generally over the summer participate in all the conferences. And as you know, all those conferences unfortunately have been canceled. What I will say, it doesn't just stop after session. We're going to give you a report of obviously everything that happened all the way up through the vetoes. But we've been working pretty intently with Kevin with even the up-to-date information on the CARES updates. We've had, I know, a lot of things, and we're trying to be as helpful as we can with the information that you're looking for, not only from Florida, but coming out of Washington, D.C. And even as recently as the DOE's response to Hillsborough and what they did there, we tried to get that within minutes of the Department of Education letting the letter go out into the community. So we just want to let you know we're there for you. Real quick on bills filed, just wanted to give you a kind of an idea of how many bills were filed compared to 2019 to 2020. You can see there was actually less bills filed in 2020 and actually a few more passed. So out of those 3,500 plus bills, only 200 bills passed the entire session, which is probably a good thing for all of us. So next slide. Thanks, Kevin. Big thing that was on all of our minds before session and during session. You all know the numbers, but the $500 million allocated and how it was dispersed, 80% of the funds to be spent on increasing the minimum base allocation, and of course, remaining 20%. We know the challenges that you all are having to this, and we also are very familiar with the impact fee, the millage rate that you took to work with their salaries also just a few years ago. So some of the dollars are right there. Sam, you want to talk about the mental health or the state schools real quick?
Before you move on, Sam,
yes.
Before you move on, Vice Chair Kennedy, I think, has a question.
I do. Sean, hey, it's Charlie Kennedy. Just a real quick question on your last point. The district share of the $500 million allocated to schools to increase teacher pay. How much of that $500 million was then eaten up by the increased FRS contributions we're required to make now?
That's on what's on an upcoming slide. That is a very, very good question, and I can assure you that was our number one topic.
I'm sorry, Sean, I see it now. Sorry.
Yep, it's coming. It's coming up very quickly.
Okay,
But that is a very valid question because we are explaining that at the same time as you're giving us, you say this great number of this $500 million, you're also taking it away from us here with the requirement to pay for the increase.
Good question, Mr. Kennedy. So to give you guys a highlight on the state budget, some of the funding mechanisms they did this year, just three big things. So you'll notice that the BSA last year was a $75 increase, and as most of you all are aware, the BSA is essentially your discretionary spending that you get from the state within the FEFP, and then this year it was only $40. So, Mr. Kennedy, you asked about some of that offset being eaten up. The legislature was convinced, and when I say convinced, I mean there was no changing their minds. This $40 can pay for the increases in the offset for FRS for districts. We tried to show them that was not the case. Nobody believed us. It was a hassle. It was tough. The mental health allocation, this is really interesting. So last year they allocated about $75 million. This year they bumped it up another $25 million for a total of $100 million this year. Which is good because the state's starting to realize the impact, in addition to probably what COVID is having on some of our students and what that's doing statewide. So this impact in dollars is going to be very helpful district-wide. And then for Safe Schools, the allocation was identical this year as it was last year. We thought maybe we were going to get some increases in there. We did not. So Safe Schools allocation remains the same this year as it was last year. And those are some of the big three changes that kind of happened this year. We just wanted to provide you guys that 30,000-foot view.
So one of the things that aren't on here before we go this real quick is there is a meeting coming up on Friday that we were going to be letting Kevin know about and having information. A panel of state economists are going to meet, and they're going to be discussing revising estimates. As you know, it happens throughout the year on general revenue, and it plays a critical role in funding our schools. Already in the 2019 and 2020 budget, there was a $1.88 billion reduction that came in there because of sales tax revenue. With the current,
Sean, if I may, so the total reduction, just to give you guys where we're at, the total reduction in revenues is actually $2.1 billion. But we actually had an increase in sales taxes on stuff like alcohol, a couple other items that helped offset some of those gains. So we had people filing their taxes statewide, corporations, that helped increase some of those offsets. So the overall loss of revenue has actually been $2.1 billion, but what Sean was getting at, the 1.8 is the net loss in revenue since COVID has taken place. Sorry, Sean.
No, it's okay. So what's not in our slides and wanted to tell you all in person is the governor did immediately after signing the budget and doing historic vetoes, he also told each department to immediately work their budgets and remove 1.5% per quarter, which would be 6% obviously for the entire year. But what we just found out today is that he's already telling them that they're going to look at having to increase that to 8.5% for 2020 to 21, and looking at avenues to be able to reduce their budgets another 10% in 21 to 22. So they're already looking at the lasting effects on an impact on the pandemic that we're all dealing with. And then, of course, the major numbers with Medicare that are impacting the state also. So I'll get back onto the slide. I apologize. But we just wanted, that information came out. We didn't even get to include it yet in the slide, and we wanted to make you aware of it. And we'll make sure that you and your board get those numbers by the Revenue Estimating Conference after they meet on Friday.
Great. Thank you.
So to go over what's on the slide here, these are the big ticket items that happened this year. The best and brightest was eliminated. That was basically the teacher bonus program that was set up. That was the first thing they came up with to help offset the costs for increase in teacher pay. That was $284 million. It was recommended. It was cut by the governor, and the bill was filed, and it was finalized. They did increase $41 million for the Guardian funds this year. The governor vetoed those dollars when he came down with his $100 billion in vetoes. They did erase the declining enrollment. Something that Manatee doesn't benefit so much from the declining enrollment, but that was deleted this year entirely. That's $3.9 million they freed up. Obviously, the big ticket item there is they did increase teacher pay, $500 million. But to Mr. Kennedy's question, so the exact offset for all 67 districts, even though there's this in simple terms, basically is a $500 million pay increase, with $232 million of that is essentially going to go to help offset the FRS costs that districts are going to be forced to pay.
Right. And I want to say thank you before we get to this last one to Kevin and his staff and your CFO. You guys got back to us so quickly with information. It was extremely helpful to go to our legislative delegation and the chairs for the education committees in the House and the Senate to let them know what the impacts were going to be on these cuts. So thank you. You guys got back to us within 24 hours. So thank you.
It's very appreciated. It worked very well. Thank you.
The next slide goes on to talk about the items that were there for funding. As you can see, we had 3 projects. We were very, very excited, as you know, when session ended, and had no idea we'd come to this by the time the vetoes came in late June. Unfortunately, you see the 2 there, even the STEM that was vetoed by the governor. The one that we are absolutely excited to get, of course, is the $2 million here in non-recurring funds for the MTC Law Enforcement Center. So in this type of environment, we're very fortunate, and we're very, very blessed to have the leadership that we had in Manatee County with Senator Bill Galvano. So I want to thank him and our delegation for helping us secure those funds. Sam, go ahead on this one here.
So we're going to give you guys just a very quick rundown of some of the major topics. Now, there's probably about 7 to 12 bills that passed this year on major educational reform. If we're missing on that slide, I have it in front of me. Just let me know, and I'll let you know what the change is. So just to go through quickly, so Senate Bill 662, this is education in the military. The cool thing about this is we're a very military-friendly state. So the legislature was starting to see that kids were being affected from a parent who is, say, stationed in Pensacola, and they're transferring over to Jacksonville Naval Air Station. So they wanted to make sure that when those transfers happened, it didn't affect the student as much. So basically what happens is if the parent's on active duty and they have to transfer bases, it allows that part of that preferential treatment is provided to the student when they come back to the district. Additionally, the cool thing, in my opinion, about this bill and what it did is that if a student takes the ASVAB in the 11th to 12th grade year, that'll actually count, depending on their score, it'll actually count towards a school grade. So, and that's kind of a neat thing within that bill. Within the tax package, the school capital outlay, this shouldn't surprise anybody, but part of that tax package this year states that if you guys go to increase any type of revenues within like a capital outlay tax, that you have to provide a statement on how you're going to share some of those dollars with a charter school. So if our charter school enrollment is, say, 50% compared to traditional public school kids, then we have to share 50% of those tax revenues if it's a new tax.
Let me step in on this one real quick. We brought Chairman Latvalin for the House Appropriations. He came to the district and met with our superintendent before session and really got to talk a lot about this bill, as a matter of fact, and how the impact and the funding would be very helpful. One of the things that that your superintendent brought up was about the training sometimes that goes into when people come from Sarasota to Manatee or even from Hillsborough and others to get them trained in these new systems. And the chairman wanted to make a priority this session. It didn't pass last session, and that was one of the good bills that did pass with funding too. So next slide. Sam, go ahead on this one here.
So here on the next slide, here's what we have, the designation of school grades. This is another way that the legislature moved this year to include technical type of kids inside school grades. And this one has to do with kids who are taking CAPE certification and student enrollment. So if they take up to 300 hours of an industry certified that's on the CAPE certified funding list, those hours and those students can specifically use those hours to help calculate into the school grade. This was sponsored by Senator Monfort. It was one of the big bills him and Representative Schoaf pushed this year. To Member Kennedy, this is another example of the FRS system. So Sean and I always like to tell some of the school boards we meet with how quickly this became a law. This bill was proposed, I believe, on February 4th or 5th. It had passed both houses of the legislature by February 12th.
Right.
Or maybe it was Valentine's Day. And so what happened was this bill moved so quickly, by the time everything no member was aware of this until the day before they were about to vote on it. So we started, we were telling them, hey, this is the impact this is going to have. this is how bad it's going to be for districts. What can we do about either splitting it in half, splicing it? What can we do to lessen the impact on districts? They were all convinced that the $40 BSA would cover this because staff was policy staff was saying that.
Right.
This here shows you what those costs have gone up to on the employer side. So on the district level, what you have to pay for some of your members now in terms of the percentages. But overall, statewide, that cost is going to be $232 million to our school districts.
So one of the items on Friday that is reevaluated is this item, by the way. They look at every single quarter how the retirement system is doing, what is needed for future income to coming in. So what is happening real quick, just to give you the 10-second understanding, is less people are taking in the full FRS retirement. Less people coming in aren't paying for those coming out. What a lot of them are doing is the other option, which is available to them, and why is the name?
Defined contribution.
Defined contribution. Thank you, Sam. So that's been part of the problem. But you can also understand with the issues that are happening right now, and a lot of things are adjusting in the stock market, as you can see. And so I would absolutely tell you this is an issue that's going to come before us next year. Again, they're going to have to make some more evaluations on that. Go ahead, Sam.
So the next slide we have here, House Bill 7067. This is going to expand the Family Empowerment Scholarship. Under current law, the program can grow by up to about a quarter for total public school enrollment each year. It's roughly about 7,000 kids. This bill increases that to 1%, providing for a threefold increase, so about 28,000 kids a year. But overall, this bill gives a clear priority for renewal students of both programs, provides for a gradual increase in household income and eligibility over time. So one of the neat things about this bill is that last bullet point on there, that if a child does not receive a scholarship when they're applying for it, the scholarship organization has to point them in a direction to help find another scholarship organization of a similar nature. So kids can know what other options are out there for them. In House Bill 37, this is school bus safety. It basically takes all the fines associated with passing a school bus when it's at a complete stop and increases them by 2. So if you pass on the right-hand side, it increases it to 400. If you pass on the left-hand side of the bus where the stop signs are, it increases it from 1 to 200.
The next slide has the last 2 items. Go ahead.
And then on our last 2 bills here, this HB 81 is a big one. So this bill is going to allow districts to reimburse for Medicaid eligible students with parental consent. That's huge for districts. You're allowed to use that for the cost now. And then it also requires that the individual education plan team to include certified listening and spoken language specialists from this family's chosen education program to determine the student's level of services that we're receiving. Very good bill. I think it's going to be very productive in terms of those Medicaid eligible students. The 945, this is another good bill. It's helping equip students facing additional mental health issues. We saw that obviously in some of the funding. This is some of the policy to go along with it. Overall, the bill focused on 3 major areas: mobile response teams, children's system of care, and stabilization of services. And at the end of the day, they're really basically they're trying to stabilize kids, getting this first in line to see assistance if there's any type of issues, whether it be healthcare or otherwise, that they can assist, and trying to get the students early on before it develops into something more serious.
And again, we've already went over this. Everybody's very familiar with the $1 billion that the governor vetoed. He also put several $1 million away into, we'll call it the rainy day fund, but the reserves to try to get us through these tough times. There has been suspicions and talks and conversations about a possible special session. Again, a lot of that is really waiting to see what happens on Friday and 3 months from now. There could be something prior to November. I don't think there will, but there could be some. They could do a special session before the end of the year and make some of those adjustments, meaning some reductions, to make sure the state of Florida, our state constitution, does not allow us to go in deficit. So we do have the reserves to make sure. But to be very honest with you, those reserves are about as good as about 35 days for the state of Florida to operate. That's about all we have, a little bit less than that. So I just want to say thank you again for letting us have the opportunity to work with you. We try to, there's 3 dozen more bills that are also passed or did not pass, so we expect to come back and we'll be reviewing again with you and your staff over the summer. We would also, as soon as we know who some of the chairmen are after the November election, we'll also be working with them about your priorities. And I just want to say thank you again. As you know, I'm consider myself a Manatee County boy, and it's an honor to represent you guys.
Thank you, Sean. Thank you, Sean and Sam. You've all just do a great job, probably the best in the business, and we're lucky to have you, and thank you.
Reverend Golden, do you have a question?
Yes, I do. Mr. Foster, at the beginning of the year, before the legislative session, the governor of the state of Florida said that he would try to award $500 million for teacher pay increases. Now, am I correct when I hear you say that, in effect, $232 million was added to the requirements of the school districts to contribute to the Florida retirement system? Is that a?
Yes, sir.
Okay.
Statewide.
Now my question is, does that reduce the $500 million amount available to increase the pay for teachers?
No, not directly, because the law still passed for it to happen and the funding was made. And so they put the burden now is then on the local districts to obviously to pay for that FRS funding from other programs, not teacher salary increases.
Okay. Now, as a local district, given the resources that we do get from the state, is that amount included in the 6% that we have to have withheld by virtue of the governor's directions for quarterly distributions? Or are these reductions in addition to trying to find the $232 million from within our own resources to contribute to the Florida retirement system?
In addition, sir.
Okay, my last question then is this. If the amount of money that was made available to increase teacher pay, and I thought one of your slides said that 80%, 20% of it was only going to be going toward senior teachers. I think that's the language, I think that's the word that you call them. The 80%, I'm sorry, 20% is spent on increasing veteran teachers.
Yes, sir.
Above the minimum $47,500. Can you tell me whether or not that $100 million is sufficient to do that particular provision? Or does anybody know? Because it looks like there's only $400 million left for...
I would just say, from the districts that we have worked with, some will be able to meet it and some will not.
Let's talk about this one. Let's talk about this district. Do you know whether we are going to be able to keep the agreement to raise the teachers' salaries here in Manatee County, the veteran teachers here, with our portion of the 20% of the funding?
So, Reverend Golden, if I may, so that 20%, what the law actually states is that of the $500 million, your requirements are to get as close as you can for new teachers or newer one-year teachers for 47.5, which, if I'm not mistaken, I think Manatee's at 47 maybe to start prior to the law. But your job is, with the 80% of funds that you receive for the district, is to get as close to 47.5 as you can, or to 47.5. And then the remaining 20% is to increase the capacity to which you can for all the remaining teachers. So how you spend your additional...
The remaining 80%, right? You said 20%.
For veteran teachers, you get 20% of the... So out of the 100% of the funds that go to the district, 20% of those are for veteran, 80% are for newer one-year teachers. For the veteran teachers, that 20%, your job is to increase above 47.5. The hope there, at least in theoretically speaking and how they applied it, is that your teachers should be at or above 47.5 already. Now, most districts across the state, that is not the case. There's a lot of bottlenecking for teachers who've been there 5, 6, 7 years. But the goal of the legislature was to say with the remaining 20% of funds that districts get, to take that and increase it as high as they can across the board for teachers.
And I don't want to turn this into a discussion, but I do have one last question. Given the pandemic that we are experiencing and the fact that that the exodus is taking place with respect to teachers, not only in Manatee County, but all over the state, how are we supposed to hire people that don't want to come to work here, that don't want to work anywhere in the state of Florida, given the coronavirus pandemic impact from the Panhandle all the way down to Pirine? How, it's like, yeah, we give you the money, but there's nobody there to take it. And I don't see any other provisions here. That
I agree with you. I would say when the governor probably started this proposal, obviously the pandemic was never, in the vision or in his, ability to predict that this would happen even to this degree. And I can't apologize for it, but I can say this, this is a challenge that the school district is having, and I know you guys have had some really tremendous challenges, and I wish it was better news. I wish there wasn't, the money from the FRS, but unfortunately that was nothing that we could have even predicted when the school year started, and we know it's had a great impact on you, but I apologize.
You don't have to apologize, because you didn't cast one vote for any of this. You did what you were supposed to do. It sounds as if in spite of all the accolades that have been placed given to the leadership, that we really need to give some serious consideration. If we want different legislation, we're going to have different legislators. Thank you.
Yes, sir.
Yes, sir. Thank you.
Does that conclude your update?
Yes.
Thank
Yes,
you.
ma'am.
It does.
Thank you so much. Thank you for your time. I guess I get better. And thank you for your time and being here with us today.
Thank you very much.
And thank you, Mr. Chapman.
Madam Chair.
Okay, we will move forward. The next item is actually my item. It's just the Greater Florida Consortium of School Boards report. I had not given one yet. We haven't had a huge amount of meetings, and the last one that we had was about a week or two ago, and it was a virtual meeting, and I just wanted to give everybody an update on it. The consortium includes basically from us down and all of the coastal counties around Florida. Obviously, a lot of what we talked about during that consortium meeting was about reopening of schools. One of the things that we did talk about was, because Broward and Palm Beach and Miami-Dade are part of that consortium, so they talked about how they're making up about 40% of the cases right now statewide, and that they're still in phase one. One of the things that did come up, and I talked to the superintendent about it last night, was something that Martin County did. Martin County worked with their local health department to put out clear directions, I think, as clear as possible during this pandemic. And I know that's one of the things that the superintendent, she's working with the health department so that there's guidelines, there's things out there so that everyone understands and everybody's on the same page in order to communicate most effectively with our community, with our parents, with our teachers, with our employees, so that we're all on the same page and we all have the same understanding of expectations. And that was something that came from Martin County, and I thought that was a really useful thing so that we all can make sure we're all on the same page. One county actually partnered with their health department for testing, and that was kind of something that we had talked about at the last meeting, was finding ways to do testing. And I know that Mr. Wagner is going to present some different options for us, so I don't know if that will be one of the options that's presented to us. But there are other counties that are doing that. That was Lee County. Lee County is partnering with with their health department. There was a lot of talk about the CARES Act. I think we've all noticed it has not come before us as approval.
Just got notice today.
All right. So we've been spending it expecting that we will get it because we need these things. But there was a lot of school districts that were talking about how they had not gotten it either. Another talk was about FEMA and reimbursement and the percentages that are being reimbursed for FEMA, and I guess that's still being negotiated, the percentages that we might actually get based on what we're spending. Of course, because right now I think the percentage that they mentioned was 87.5% of what we spend we'd get back, I think. But apparently that's still being changed. Yeah, so there's that. But we also all know, we've all gone through this before with hurricanes. FEMA
Takes forever.
We may get it, but it won't be this fiscal year. That's really clear. We know that. They did talk a lot about the next federal package. They also talked about the state revenue, which was highlighted in our presentation we just had about how we were under by $2 billion in revenue. And that we know, and we all know, and they said it again, that they're going to revisit the budget in November. They've said that they're going to revisit it after the elections. The last and final thing, and I try to be short and sweet about stuff, the last and final thing that got brought up was the consortium would like to build some legislative priorities. Now, we know that session is not going to start until, I believe, March, because it's an election year. But I do believe committees begin maybe in December. I trust you to know that. Yes. December. All right. I trust you to know that too. So December. But they would like to have them combined from all of the school districts before that, and they would like to have them by the end of September. So at some point in the next month or so, one of our meetings or a workshop, I'm going to add that so that we can kind of come together and figure out what kind of priorities, and it doesn't have to be our total list, how we normally do, but anything that we'd like to join in with the consortium on. So I'm saying that now so that you can start to think about what type of things could we join in with the consortium on to focus our efforts. And with that, I will leave it at that, just as a thing that will come back. We will discuss it, and to start thinking about what's the smartest way to do that. I will say the state teachers union, they focus on one thing, and their one thing did happen, although I say it would be mitigated by FRS. But at least if you focus on one, it's hard to argue with, well, you didn't do that one thing I asked. So I don't know if that's the better avenue, or if it's better to go wider, and then they pick and choose. Well, I think we'll do these 3, but we won't do these 7. So I think we'll have to be strategic about that. But that's really a conversation for another day. And with that, I will move on to Mr. Minor. Mr. Minor, you want to tell us about your FSBA teleconference meetings?
I will be very brief. We have not had a telephone conference in the last 2 weeks, but I would like to remark that what your report, suggested is something that I endorse, and I think that the FSBA has been pushing to get our recommendations, for legislation put together, the sooner the better. So, thank you for an excellent presentation. And I think that what you covered were topics that with FSBA we've been talking about, and you have done a great job of putting the urgency that we need to get our voices singing the same songs. So thank you.
Absolutely, we are stronger together.
Yeah.
And then we will move forward with the Braden River Middle School renovation and addition schematic design presentation. Ms. Drager.
Well, good evening. This is a new effort for us at the superintendent's request to present the plans to you at a meeting so that you have a better understanding of the projects as we're moving forward with them. So I'm going to just very quickly, first I want to introduce the team that we have. So the architect is Long and Associates Architects, and we have Travis Steed, Vice President, with us here today. The last project they did with us was the Manatee High Davis building. NDC Construction, today we have Brando Fetzik with us. He actually was on site at Harvey Elementary School. And then we have the project director, Reggie Goff. He's, how long have you been here, Reggie? 6 years with the district now. Feels like he's the newbie. And his assistant is Laura Bartels. So I thought I'd do a quick history of where we've been. We started the selection process for this project back in September of 2019, and we moved forward with the contracts to these firms on March 24th of this year. We did an extensive study of the existing conditions, and we started the schematic design. We have since reviewed that schematic design, which we're going to show you tonight, with IT, maintenance and operations, and food service to get their input, and as well as with administration. The project budget was deemed adequate. And just a little plug here on a personal note. I know that teachers who teach and then their children of their students come back and they get to teach multiple generations. Braden River Middle School is my first project out of college. I was in the job site trailer as the project engineer, so this is kind of like seeing my who I taught's child now, getting to renovate this project. So where we are now, today, we're going to present this to you. We're going to go through page by page, building by building, so that you have a clear understanding of what our scope of work is. You have 3 items on the agenda for tonight, which is the building official contract. For those of you who don't know, we use a third-party firm. There was a selection process for that, and we'll be issuing that contract with your approval tonight. The schematic design documents in their entirety, and then our AE and CM contracts call for letters of commitment at each of the 3 stages. So those are before you tonight as well. And then where we're heading, if we get all these approvals, we'll begin design development, we'll verify the budget, we'll re-review it with all of the staff, we'll present it to the board, and it will be a similar process. So overall, this renovation is a comprehensive campus-wide interior renovation. We're going to expand the cafeteria, which is very undersized for the number of students. We're remodeling the science labs. The middle school science curriculum has changed considerably since these labs were built. We're remodeling the administrative suite pretty much completely so that there is a single point of entrance. And we're adding a 6th classroom wing addition. Okay. Thank you. Okay. Thanks. This project was in the Jacobs engineering study that we did last year, as they called it one of the worst 9. It had a poor condition with a facility condition index of 30.7. So we have some before pictures here for you. It is a $26 million project. It is funded. It is included in this year, in the current 5-year capital plan. $7 million this year, $8 million next year, and $11 million the following year. So that said, the next thing you have before you is a site plan with the buildings numbered. Not much in the way of site work, but we are going to make sure that we have a secure site. We are going to review the queuing line, which has since been lengthened, but still probably needs additional linear feet of queuing to get the cars off of River Club Boulevard. Exterior paint, it's a brick building, but all of the interior atrium areas will need to be painted. And
Before you move on, Mr. Kennedy?
Yeah, thanks, Madam Chair. Jane, before you go, and I peeked ahead to see if you're going to go there, but as long as you have this, Nick, could you go back to the PowerPoint, please? Or whomever, Susan, there we go. Jane, as long as we have this one up, could you just talk about how the how the work will kind of move its way across campus?
that hasn't been decided yet.
Oh, okay, okay. That's
The actual phasing and sequencing, a lot of that will depend on when we finish construction documents and when our first summer start is. Typically on these renovations, we build the new building first, and then we move students from from another building into that building. But the building we're building isn't as big as the buildings on campus right now, so it might be phased more than that. We'll also probably, and Brando, if I'm wrong, correct me, address the building one, the front office, try to do as much of that work over a summer. Like what we did at Johnson, which is the sister school, it's the same prototype. We relocated their front office into the gym multipurpose room. Had a nice, easy access, not a great home, but they made it work. And then we moved them back in. So we tried to do that work over a summer. The cafeteria expansion would probably be another summer, where we would build the addition, and then when it's done, demolish that demising wall, so we would open it up. But that phasing hasn't been established just yet.
Thanks.
Okay. And the last thing is looking at the removal of the courtyard planters. Apparently they can't keep anything alive in those courtyard planters. So that was something we were looking at. So the way I formatted this is, obviously this is by building. I highlighted in yellow on the floor plan the over and above added renovation. So on this slide, the one on the left is basically what we're doing everywhere. So that is when we do an HVAC renovation, typically that means we're going to remove the ceilings, we're going to remove the lighting, we're going to remove ductwork, the overhead equipment, some casework, and flooring. Then we're going to install new ductwork, new HVAC equipment, new lighting, new ceilings, new low voltage systems, interior paint, and partial new casework. Typically we go through and what needs to be replaced, we replace. New flooring, and then new doors. What we learned on Johnson was that all of the exterior doors needed to be replaced and most of the interior doors were fine. Don't know if that's the case here. We'll get to that point. They did, Braden River Middle School did just have a instructional technology upgrade, so we're intending to reuse that in all but the addition portion, and then that would get all new. But in building one on the first floor, the additional scope of work is we're going to be doing demo in the administrative suite and a portion of the library. The old design has a very space heavy, poor utilization hallway that runs between the media center and the admin. We're going to get rid of that like we did at Johnson and make that usable space in the media center and the front office. We're also going to have the entrance to the front office be outside of the courtyard. You know how at Johnson and the school you had to walk onto the campus into the courtyard through the front door. So we're really going to change that configuration. The students will be able to enter the front office from inside the school. Visitors will be able to enter the front office from the outside of the school. And the media center will get reconfigured. Because of that, we'll be doing a lot more new casework, new flooring, new doors, new walls. That area will look basically brand new. The next one is the second floor of building one, which gets all the same standard things we talked about. But each of the science labs, and there's 7 on this floor, will get that reconfigured for the new science technology. The second floor of this building also has a terrarium that the ACT folks are looking into restoring it for use by an agriculture program. So this will look much like Johnson. Then in building 2, pretty much as straightforward, what we consider the HVAC renovations. The clinic is located on the first floor. That's the area you see highlighted in yellow, and that will be reconfigured to meet today's clinic standards. Building 3 is the gym, locker room, and multipurpose room. The multipurpose room will be outfitted with the temporary front office. And then when they move out, it will be restored as a multi-purpose room. And the bleachers in the gymnasium, we've been working with the school site staff and maintenance and operations, and they really like the wooden bleachers that are there, so those are going to be repaired rather than replaced with the plastic ones. Building 4 is pretty much just the straight HVAC renovation scope like we talked about. Building 5 is the cafeteria. This is going to get the expansion, and the yellow is the additional inside seating area. It will get new furniture in the cafeteria for added seating spaces. The area that you see that's around the yellow will be covered eating and additional covered walkway. And that brings us to building 6, which is pretty much straight HVAC renovation. And then the last one is building 8, which is the 6 classroom addition with teacher planning, group restrooms, and as part of this building, we'll have secure portals to make sure that this building is completely tied in and inaccessible from anywhere outside of the school. And we'll have the proper additional covered walkways, secured portables, basically a whole new building. And then it has the group restrooms along the covered walkway. And with that, I'll open it up to questions. Did you like this format? Is this better to walk through at a high level with you? Helpful?
I liked it, and I like not only that you're giving the information to us, but I think it's important for the community to see what is happening and where their tax dollars are going and all the projects that are happening. So I appreciate it.
Happy to do it.
I had one question.
Okay.
Oh, I guess I kind of see it now on this. I was trying to figure out where exactly building 8 was going to go, but I see now that it's this little green one on here.
Yeah, so I did on the site plan, you can see it's, if you look at the aerial photo, it's like right below where the logo is. So it's right off of that parking lot.
Okay. Are there any further questions? Thank you.
Madam Chair, may I
Yes,
just?
Mr. Mayor.
Yeah, Jane, can you talk about how these new designs affect the security for students and staff in this building over the present arrangement of access into it? I think that's one of the reasons why, to get into the offices, you have to go through there now.
Right.
And I think those changes, those modifications are significant, that needs to be brought up, for the security of our staff and students, and I think it's a really good plan. So, but maybe you can comment on some of the.
Yeah, so I appreciate that. What we did at Johnson, really, 30 years ago when we built schools, we wanted everybody to come onto the site. We wanted them to come in and interact and see the kids moving around. Now we want to keep everybody but the students and staff out, control them at a single point of entry. So what we did was really studied that front office and made it so that all the visitors come in from the outside, but all the students come to the front office from the inside. All the circulation of the students is controlled. So you can't get in any other way but the front office if you're a visitor.
Okay, thank you. Thank you.
Thank you. Thank you all for being here. Thank you. Okay. With that, our next item is our first public hearing. So with that, I am going to close our regular meeting and open up our public hearing. And our public hearing is on the proposed changes to the Student Code of Conduct for the 2020-2021 school year. And Vice Chair Kennedy, I'm going to hand it over to you for public comment for the public hearing about the Student Code of Conduct for the 2020-2021 school year.
Okay. I don't see any previously entered public comment. Would anybody like to step forward to address the Code of Conduct? This is a public hearing, so you can just step up without registering to speak, if anybody would like to. Madam Chair, I don't think we have any comment.
Okay, then I will adjourn our public hearing and reconvene our regular meeting. And I'm going to ask Madam Superintendent, do you have a recommendation on the approval of adopting the amendments to the Code of Conduct for the 2020-2021 school year?
Yes, I'll recommend the approval of adoption of amendments to the Code of Student Conduct for the 2020-2021 school year.
So moved.
Got a motion?
Second.
And I've got a second. Is there any discussion?
Sure, just one second. Madam Chair, I just have one question. Sorry, when I logged on with my desktop, it moved all my icons on my desktop around, so it's taking me a second to, I knew right where it was, but then it refiled everything. Superintendent Saunders, is it addressed specifically, and I believe that it is, I just wanted to find it real quick because I know this is going to be a hot button, at least during this school year, is I'm assuming it's in the insert, which is what I'm looking for right now, but where is the language in the Code of Conduct for a student who refuses to wear a mask?
Yes, that the mask and COVID information is in the insert, and it's referred there. I believe Mr. Schreier is also here, who ran the committee on that, if you have any specific details. But we do have it addressed. One thing that was brought to our attention, I believe we had just two types of comments on the whole Code of Conduct. One was about the parent piece, which we corrected, but the other was when the CDC updated some guidelines about the mask. It was brought to our attention. We still had some old language, and that was corrected for the most current CDC language in there.
Okay. I'm just looking at the insert now. Number one on the, Madam Chair, if I may.
Mm-hmm.
Number one on the insert is dress code. Students are required to wear facial coverings, covering the nose and mouth at all times while on school grounds. Facial coverings or masks may not have the images of alcoholic beverages, tobacco, or drugs, or contain language, artwork, symbols, or images that may be considered offensive, disruptive to the learning environment. Which the end of that, crap, I can't see either way, is basically kind of our standard language that applied to just clothing, but we're applying that to masks. The one change that I would request here in number one is students are required to wear a mask, not just a facial covering, and I know we're going to cover this later in the policy that's on the agenda. And kind of a related question, the policy where we're putting that into the policy book, that applies to not just employees or that applies to everybody on campus, students as well.
Correct.
Okay. So we'll cover it there a little bit later too, but just maybe for uniformity, students are required to wear a mask because we've been having over the past couple weeks this debate about, and Dr. Hope started this conversation at the July 14th approval about a shield, which up until that point, we had been calling a facial covering. And then in that conversation on the 14th, we kind of changed the conversation. So board members, I don't know where.
Mr. Kennedy,
where
would you
stand on it.
like maybe what I can do, because the policy is further on.
Later.
Maybe what I should do, or what we could do, is just refer to the approved board policy.
Okay, that would be fine.
I mean, if you want to,
Yeah, my only goal, however we do it, is fine. My only goal is just to make sure there's no wiggle room between the language in the code of conduct and in the policy manual. So however we get there, I just want to make sure those two lines match up, that's all.
so if that may bring uniformity and clarity, we certainly can go back and look at, once that item is passed, if it's passed, we can go back and just make sure the language is mirrored.
Yeah, and if the board agrees, that would be my ask of the board, is that we just, when we do approve that policy later in the agenda, we incorporate that same policy into line 1 of the COVID insert.
Is there any other discussion? I don't like confusion, so I think there should be uniformity no matter which way the board decides. So, Reverend Golden.
Yeah, the only question that I have is, if we do that now, is there an implication that that there was some discretion about masks before this change was effected? I have no problem with the uniformity. I just want to make sure that we aren't giving leeway to someone who could contest the language as being not what we agreed on before. And I'm not so sure how to verbalize that without doing violence to the notice provisions and all of that we have already that we've already sent out. In other words, this language that we have here is the language that we published, and so I'm concerned about changing the language at this point, and then being subjected to hearing that, well, that's not what was published, that's not what was approved, and then all of those attendant arguments. So if someone could share, how can we do that? How can we change the wording without, how can we change the meaning of the wording? I guess that's what I'm really asking, because we agree that it should be masks. That's what we're talking about. That's what we approved, that's what we voted on. And so I'm just kind of wondering if we do not cover that in the policy of the district regarding everybody, as opposed to specifically putting it in the student progression plan at this time, and then having that come up as something that was not advertised and something that was not proposed. And maybe that's not a real issue, but then again, maybe it is, and we won't find out until somebody's child sues us for violating their rights and all that kind of stuff, and it just goes round and round. That's the only concern that I have. If somebody can say, no, this doesn't create that kind of ambivalence or that kind of uncertainty, I'm happy with that. But I just want to make sure we have that to back us up. That's all.
Madam Chair, if I can speak on this?
Please.
I think the language in the plan should be left as it is. I think it's up to the policy to define, as time goes on, the type of face covering that is approved, because that's going to change over time. I mean, already we're seeing where the shields are not approved. Now they're talking about the valves that are in some of the masks. They don't want you to have a valve. So I would recommend leaving your code as it is. It is a face covering that says the mouth and the nose. And your policy needs to be flexible and change as the science changes and the technology changes. That'd be my recommendation.
So perhaps following what the superintendent recommended, where it notes specific policy in it, might be the best way to ensure that it's matching.
Yes,
Am I understanding that correctly?
Yes, I think that the policy, you need the flexibility to change what's an approved face covering.
I'm looking back at the policy number so that maybe perhaps we can,
We could just reference that number.
8450.
Would that be the best thing?
Yeah,
for
policy.
Policy after it's approved.
8450.
Just add that number in there so we know that that is our governing document.
So could we say, students are required to wear facial coverings in accordance with policy 8450 at all times while on school grounds?
Bingo.
Is that fine?
Yes.
Is
and then
everybody
you
okay
can-
with that?
You can review that policy from time to time.
Sure, I think we'd have to expect that.
Thank you.
Vice Chair Kennedy.
Yeah, Madam Chair, I would just suggest, I completely agree with what you just said. I think that's a great solution, but I would delete the phrase "while on school grounds," because we also have confusion about the one thing that this board has been way ahead of the curve on is a mask policy, and we've been talking about it since June 25th. And board members, if you remember, what we talked about that day was a policy of masks being required when you're inside a building or inside a bus, not quote unquote on school grounds. So I think you're exactly right, Madam Chair, that we should use that sentence you just said. But when you say while on school grounds, that applies as soon as you step on campus, you have to wear a mask, which was not the intention of the
How about
board.
while on school property? That's a bus's property.
That, to me, though, means if you're outside on the playground, although we can talk about this later when we do 8450, my original intention was if a student is outside of a school building, they could take their mask off. And I know that gets us into a whole bunch of, what ifs.
Perhaps students are required to wear facial coverings in accordance with policy 8450, period.
Perfect.
Is that okay with everybody? We alter it in that manner. Does that need to be made into a motion, or can I just say as amended? Do we need to make that a formal motion?
I think you probably should.
Okay. Is there a motion to amend the student code of conduct, COVID 19 guidance?
Yeah, Madam Chair, if I may, I'd like to make a motion to change the first sentence of item number 1 on the COVID insert, and that for that sentence to read, dress code dash students are required to wear facial coverings in accordance with policy 8450, period.
Second.
Okay, there's been a motion and a second. Is there any further discussion on this amendment? Hearing none, I'm going to vote on the amendment to the student code of conduct. All those in favor of the amendment, please signify by saying aye.
Aye.
Aye. Any opposed? Okay, that passes unanimously. We're back on to the student code of conduct. Is there any further discussion? My only question, I think you kind of already addressed it, was what kind of feedback had you received? I know we had gotten a couple concerns about one section. I know that you addressed that section. I see that you updated this to adhere to CDC guidelines. I truly appreciate that. I think this is going to be like a moving target, and we have to continue to stay up to date. And the CDC keeps, changing their guidelines, and we're going to have to continue to do that as well. So, hearing no further discussion, we will move forward with approval of the code of conduct as it has been amended. It has already had a motion and a second. Seeing no further discussion, all those in favor, please signify by saying aye.
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 Aye. Any opposed? All right, that passes unanimously. Okay, on to our next public hearing. Now, we had these public hearings planned earlier, but since this is the first time we're able to open it up, this is why we have so many public hearings today. So I will adjourn our meeting, reconvene, convene our public hearing for the student progression plan, and I will turn it over to Vice Chair Kennedy for public comment on the student progression plan.
All right, step right up if anybody would like to comment on the student progression plan for 2020-2021. Mr. Schreier, would you like to speak to this? All right, Madam Chair, no one is stepping forward, so we can move on.
Okay, then I will close our public hearing and reconvene our regular meeting. And I will ask Madam Superintendent, what is your recommendation on the approval of the 2020-2021 student progression plan?
Yes, I recommend the approval of the 2020-2021 student progression plan for elementary school, middle school, high school, and K-12 virtual education.
So move by Minor.
Second?
I've got a motion and a second, and since both y'all are in this room, can you hit your buttons? Because can't always do that when Dr. Hope's doing it too. So if you're here, please hit it. No, you're not logged in. It's okay. It's okay.
I'm on buttons.
It's all right. We got it. So we got a motion and a second. Is there any discussion? Well, I don't see any. I have a question. Did you receive any other feedback from the community about the student progression plan?
No.
Okay. Well, I appreciate all of the work that has gone into creating it and updating it. Seeing no discussion, I will call the vote. It has been a motion and a second. We are on the approval of the 2020-2021 student progression plan.
Okay. The next one.
All those in favor, please signify by saying aye.
Aye.
Aye. Any opposed? All right, that passes unanimously.
Okay.
Okay. We are on to,
It's the magic word.
yes, our third public hearing. I will close our regular meeting. I will convene or open up a public hearing on the bylaws and policies. Vice Chair Kennedy, I'm going to turn it over to you for public comment.
Roger.
Okay.
Like that. You're not three?
This is
It's public hearing
three
C.
pieces, but which one did you want?
She's just speaking during the public hearing, and then you'll have two separate votes.
Oh,
One
I'm
for
sorry.
the bylaws and
Okay.
one for the policy.
Thank you, Michelle. Ms. Foreman, you signed up to speak? Sorry for my confusion.
No problem. Thank you. I'm Mary Foreman. I'm here as a concerned citizen. I don't need to tell you when trust is broken. It takes extraordinary measures to restore it. Tonight's agenda approving adoptions and amendments to bylaws, 6 bylaws and 23 policies, falls short in many ways. Some of these make significant changes. For example, instituting the board members' reimbursement for in-county mileage, ethics policies, nepotism, public comments, and sick leave. In order to be transparent, I would suggest that these bylaws and policies, these particular ones, be voted on separately. The public should be able to weigh in on those changes and know a board member's position on those issues. And I want to specifically address a change to one of the bylaws that will have a negative impact on the public's trust, and that's the standards of ethical conduct. The most problematic issue in the ethics bylaw is the policy regarding gifts. The changes to the bylaw bring it in line with Florida statutes. It states that gifts are defined by Florida Statute 112.312, and note that that statute states that political campaign contributions are not considered gifts. Now, the bylaw goes on further to state that members cannot accept anything of value with an understanding that the board member's vote would be influenced. That's a difficult thing to prove. Recently, a board member accepted campaign contributions from vendors of the district and individuals associated with 2 of its construction contractors, and he did not recuse himself from voting on a contract with one of those contractors that came before this board at the July 28 meeting. The school board of Manatee County needs to set high standards for ethical conduct in order to prevent something like this happening again. CPAs and attorneys are trained to avoid not only actual conflict of interest, but the appearance of conflict of interest. Behavior such as this, while allowed by the policy, unless there's evidence of influence, has the appearance of a conflict of interest. The board already has a trust problem. Unless it adopts and follows policies that are stricter than state statutes, it will continue to have a trust problem. I recommend that you vote on this bylaw separately, revise the definition of a gift, and require that a board member recuse him or herself when there is any possible appearance of a conflict. This will restore public confidence that the board is not being unduly influenced and is in all matters placing public interest above personal considerations. Thank you.
Thank you, Mary. This is a public hearing, so if anybody else would like to step forward and speak to any of these policy items. Madam Chair, that concludes comments.
Okay, then I will close the public hearing and reconvene our regular meeting. Is there any discussion? Okay, hearing none, I would like to state that these policies have been presented and the bylaws have been presented at a workshop. They've also been reviewed by our attorney to ensure that they are compliant with the law. So I would really appreciate all the work that's been done to have them here. Any further discussion?
Madam Chair?
Yes.
Yeah, I would, I think Mrs. Foreman raises a good point, which I had not thought about before it was just made, so I'm a little bit unprepared. And I'm looking at the language right now. So instead of dragging down the meeting or taking a recess, would it be possible that we approve the group, but would it be proper, Mr. Dye, to make a motion to postpone policy 0124 to the next meeting?
0124.
0124, standards of ethical conduct. Okay. Just make sure I'm in bounds here. But Madam Chair, if I may, I'd like to make a motion that we remove from this approval and postpone until our next regular meeting the approval of policy 0124.
Okay, there's been a motion to remove policy 0124 from this section. And you want to postpone it until the next meeting? Is that the word you would like to use there?
Well, or postpone to a date certain, whatever's the, I just want to get to it at the next meeting. That's
Okay.
what I'm trying to do.
Is there a second? Hearing none, we will move forward as it is set. Is there any further discussion? Okay, then we will vote. The first item, since it is our bylaws and adoptions and amendments, I need a motion from the board in order to adopt the approval of the bylaws and adoption and amendments.
So moved.
Okay, I've got a motion for the approval of the bylaw adoption and amendments. Do I have a second?
Second.
Okay, I've got a motion and a second. Dr. Hopes, are you still with us?
Yes, ma'am.
All right, just making sure. You've been so quiet. Okay, so we've got a motion and a second. Is there any further discussion? Okay, we are on to the approval of the bylaws. All those in favor, please signify by saying aye.
Aye.
Aye. Any opposed?
Opposed?
Okay, it passes 4-1 with Vice Chair Kennedy voting against. We will move forward to the policy amendments. Madam Superintendent, do you have a recommendation?
Yes, I do. The approval of adoption of Neola policies 2371. We're on the 5113. 8406, and 3 new district policies for absenteeism, amendment to policies 1130, 1213, 1380, 1430.03, 2623, 3130, 4130, 4430.03, and we recommend the approval of all of these and the deletion of policy 5335.01.
So moved.
Second?
Okay, we have a motion and a second to, I'm going to summarize that, to add, amend, or delete the policies that have been listed.
Perfect.
Is there any discussion? I feel like like I said, we had a workshop. We really did discuss these things in a previous workshop, and we've just been waiting for this day. So we've had a motion and a second. All those in favor, please signify by saying aye.
Aye.
Any opposed? Okay, that passes unanimously. Let's move forward to the approval of the minutes. Madam Superintendent, do you have a recommendation?
Yes, I recommend the approval of the minutes from July 23, 2020 Board Workshop, July 23, 2020 Special Meeting, July 28, 2020 Board Meeting, and Public Hearing.
So moved.
Second?
All right, I've got a motion and a second. Is there any discussion about the approval of the minutes? Hearing none, we'll move forward with a vote. All those in favor, please signify by saying aye.
Aye.
Aye. Any opposed? Okay, that passes unanimously. Let's move forward with the consent. Madam Superintendent, do you have a recommendation?
Yes, I recommend the approval of the consent agenda for August 11th, 2020.
So moved.
Got a motion? And a second. We will vote. All those in favor, please signify by saying aye.
Aye.
Aye. Any opposed? All right, that passes unanimously. Let's move forward to new business. Discussion items pulled from consent. And I know that we also had an item pulled. I do not see it on my computer, but I know there was a third item that Reverend Golden has pulled. It is not on my computer. However, we will list it as the third thing on new business non-consent items.
Madam Chair.
Oh, I see it. Oh, I'm so sorry. It's just not on my computer listed there. It is new business items, discussion items pulled from consent. It is number 1. I apologize. I stand corrected. So we are on approval of the School District of Manatee County Mental Health Assistance Allocation Plan. Reverend Golden.
Madam Chair.
You're just so popular.
Madam Chair, I promise to stop calling.
Will you stop calling him,
Reverend Golden,
please? He's
yeah.
sitting right there.
He never answers his phone here. Okay.
Okay, Madam Superintendent, do you have a recommendation for the approval of the School District of Manatee County Mental Health Assistance Allocation Plan for the district in the amount of $1,733,920?
Yes, I recommend the approval of the Manatee County Mental Health Assistance Allocation Plan for the school district in the amount of $1,733,920.
Moved by Minor.
Got a motion? Do I have a second?
Second.
I've got a second from Dr. Hopes. Is there any discussion?
Madam Chair,
Reverend Golden.
thank you. I had asked that this item be removed from the consent agenda to avoid even the appearance of impropriety with respect to a portion of the funds that are going to be awarded under this plan. As I indicated before in this setting. I have recently become the chair of the board of directors of the Centerstone Behavioral Health system here in Florida. And so out of, because there's a possibility that I could have a conflict of interest, even though I'm an unpaid member of that board, I would not be voting on this particular item, and will be filing Form 8B. Yeah, I will be filing a Form 8B to avoid the appearance of a conflict of interest in this matter. Thank you, Madam Chair.
Okay. Vice Chair Kennedy, you signed up to speak?
I sure did. Thank you, Madam Chair. Superintendent Saunders, I had a question for you on this one.
Yes.
And this was kind of, I'm bringing up this late. I'm kind of putting you on the spot because I caught an email about this late afternoon. But on page 6 of the board work, it says, and maybe this is standard, and I've just never caught it before. I don't want to say seen it, but caught it. But on page 6, near the bottom of the page, it says Centerstone approximately 1.1 million. And then in the paragraph below, it says the school district of Manatee County contracted with Centerstone for 15 mental health counselors, and then in parentheses, registered interns working on their licensure. So is that an industry standard for us to be paying about $70,000 for an intern? Or do we know if those interns are paid any part of that?
They are paid. I will tell you, it is a practice that's been in place here for quite some time. It's very difficult to find mental health counselors, and that is what they tend to do because, of course, they have to, have all of their credentials and so forth. And in order for them to get certified, they have to do a number of hours with a mental health counselor that's approved by the state to sign off for submission. So by getting them, I guess the philosophy would be that we're working with them as they're finishing up their internship. If you're going for a teaching certification, you have an internship for a very short amount of time. So they are paid, but they're not paid at the rate that a full-time licensed employee would, but it kind of adds another layer of support for a little less money. Also, the hope is we're always in demand of looking for those employees, kind of like our partnership is with University of South Florida. We're hoping that if we do have open vacant positions, once they complete, we can hire those folks into our organization as well. So I can't say for sure how many districts do that, but it is a practice that has been in place in Manatee County for quite some time.
Thank you.
Yeah, I had that email as well, and I responded back to the person, it's not just necessarily how much that person's even paid. We don't know what other benefits they might be offered. That, when we consider like how much we pay somebody, we consider the benefits and everything else that goes into it, whereas somebody that they may only consider what's on their paycheck, but there's a lot more that goes into it. So, that was something to consider. And the other thing that I thought was really interesting is if in this executive summary, it actually talks about how part of the plan is you must work with a community agency.
Yes. You can't be licensed without.
You can't do this without doing that. So in some way, you have to work with them, So I appreciated that.
And Gina, one follow-up?
Yes.
So Superintendent Saunders, they have to, the intern position, they have to be supervised by one of our employees, or is there kind of a gradual release where that intern can work on their own?
They have to be supervised by one of ours, but also under the umbrella of the agency that we're working with them. But so, no, they can't. They're under the umbrella when they're contracted and working with us, with a supervisor as well. They're not able to sign off on formal documents as the official person of record, but they're able to do the counseling support for the schools and help with all the other logistics as well.
And then this is, do these services have to be provided on school campuses, or these could be services provided at the Centerstone campus also?
Either one, as long as they're providing our services. But predominantly, we use them to come in and help our students on our campuses or contact with our students. And then it could be that they're providing after hours or so forth as well.
Madam Chair,
Yes.
I know that I have to abstain from voting, but I don't have to abstain from talking. And this particular provision,
I will say that the form you fill out does say that you have to not try to sway.
okay.
I'm just trying not to get you in trouble, sir.
I appreciate that. That's fine.
Save it for your board comments after the vote. How about that?
That's fine.
Madam Chair.
Yes, Dr. Hopes.
Thank you. Mr. Kennedy, this is a very common practice for, for students that are working on licensure as, as social workers and counselors, that they will work through their internship through a local agency, and as part of that, they're supervising them, and then also they provide that supervision while they're working on site with our students. So it's a pretty normal practice, actually, in most states.
Okay, thank you.
Okay. Is there any further discussion? Okay. Then I will move forward with the vote on the approval of the School District Manatee County Mental Health Assistance Allocation Plan. All those in favor, please signify by saying aye.
Aye.
Aye. Any opposed? And signify that there is one abstaining, Reverend Golden. So it passes unanimously 4-0. Okay, we will move forward. We are on to approval to purchase COVID-19 related supplies. This COVID-19's in there twice. Not to exceed $1.7 million. Madam Superintendent, do you have a recommendation?
Yes, I recommend the approval to purchase COVID-19 related supplies not to exceed $1,700,000.
So moved.
Second.
I have a motion and a second. Is there any discussion?
Actually, Gene, I do have a question.
Vice Chair Kennedy.
Thank you. I appreciate that in the board work, it lists multiple items that can be included in this item. Kind of the comment I made at the last board meeting when we had a $350,000 item. I am a little bit leery of just blank checks. I understand the need for that because we have to move quickly in this environment. But I think as a practice, just saying to the superintendent, here's $1.7 million and go do with it what you want, gives me a little bit of pause. But one thing I don't see here, and I know we're probably going to get to this at the next meeting, but I'll circle back to it now anyway, is the rapid testing. So I really just I guess I had a question about what is our game plan to circle back to that topic?
It's on the agenda tonight.
Right. Yeah, Mr. Wagner has a presentation for you, or the information to follow up with you on that tonight.
Okay, thank you.
And Madam Chair?
Dr. Hopes.
Yes, to this point, Mr. Kennedy, we spent a considerable amount of time going through this issue, and what we discovered is basically within the district, obviously we have two sort of categories of employees. We have employees that are covered under our district health plan, and those rates are negotiated on our behalf with Florida Blue. And in addition to that, it is a covered service, which is part of the CARES Act and is provided with no deductible. What we discovered in our deliberations over the past week and a half is that in the CARES Act, HRSA, which is part of the federal Department of Health and Human Services, has funding to cover COVID testing, including rapid testing, for the uninsured. So laboratories are provided to be able to directly bill HRSA for COVID testing, including rapid tests, for all uninsured individuals in the United States. So therefore, even though there will be a dollar figure in the follow-up presentation by Mr. Wagner, we have discovered that basically all cost for COVID testing for both insured and uninsured individuals is covered, and therefore we would not need to allocate additional funds. There are some districts in the state that have allocated funds and then are paying for these tests, and they're doing so, I suspect, without knowledge that HRSA has a program for covering the cost of these tests for the uninsured. Thank you, Madam Chair.
Thank you. Is there any further discussion on approval to purchase COVID-19 related supplies?
Yes, Madam Chair.
Yes, Mr. Minor.
I appreciate Board Member Dr. Hope's comments on that. Can we have some comments with respect to when rapid testing will be more available, here for our employees and the community?
That is an item on the agenda later on. We will
We're gonna
hear more
get
options and learn more about it there.
Okay, that's fine.
Is there any more discussion on this item, approval to purchase COVID-19 related supplies? Okay, hearing none, we will vote. All those in favor, please signify by saying aye.
Aye.
Aye. Any opposed?
Opposed.
So it passes 4-1 with Mr. Kennedy dissenting. We will move forward. Madam Superintendent, do you have a recommendation on approval of amendment to policy 8450?
Yes, I'll recommend the approval of the amendment to policy 8450, control of casual contact of communicable diseases.
So moved.
I've got a motion. Do I have a second?
Second.
Okay, second.
I've got a motion and a second for the approval of policy 8450, which is the policy that we noted in the student code of conduct. Is there any discussion?
Madam Chair, if I may.
Vice Chair Kennedy.
Yeah, Madam Chair, I have some edits to the language that was posted with the agenda and is in our board work. And Michelle, our agency clerk, just passed out these edits. And Dr. Hopes, there is one on the way to you via email. And I apologize to the audience that you're not looking at this, but I'll just go through it really quick. In the first sentence, as part of emergency procedures to be implemented by the federal, state, and local officials related to the COVID-19 pandemic, the Centers for Disease Control and Prevention and the Florida Department of Health recommend everyone wear a face covering, and I'll stop there because this might. So what I suggest is we cross out covering, and then I have added everyone wear a face mask that covers the nose and mouth to help prevent community spread of the virus. So what I'm going for here, Madam Chair, is just to clarify this kind of what's approved. Is a face shield approved, or is a mask, or one or the other, or both? And what I want to make clear here is that the expectation is a mask that covers the nose and mouth. I know somebody could make the argument that, well, a shield covers my nose and mouth, but I wanted to specifically use the word mask instead of covering. That's change number one. The state of Florida is currently under executive order by the governor declaring COVID-19 a health emergency. Period. Strike the rest of that paragraph. Next, second paragraph. Therefore, in order to implement immediate mitigation measures during this pandemic, the school board hereby mandates that all employees, visitors, and students wear a face mask. Period. That's all the same language. I'm striking the period and other approved face covering. Again, I'm just going for clarity on mask. And then I have added, when indoors, any school board of Manatee County, school property, facilities, transportation vehicle, I've added vehicle, comma, I've added including school buses, and then strike the rest. So I've just tried to make it more clear with mask and just shorten it up because some of the, unless somebody else sees a need for the end of paragraph 2, I just didn't see why it was necessary. But that's it. That's my suggestion. Dr. Hopes, do you see it yet?
Yes, sir. I have reviewed it.
Great, thanks. Thanks, Madam Chair.
Okay. Reverend Golden?
Thank you, Madam Chair. The only suggestion that I would like to make is that instead of limiting this to indoors, since we know now that the virus is spread not only through the air, and through contact on surfaces, but by aerosol dispersion, I'm more inclined to want us to not give vent to the children then going outside and taking their masks off, and who knows what could come from that, as opposed to simply saying when you're on school board property you wear your mask. We just heard a presentation earlier this evening about mask up, and I didn't hear any differentiation being made between indoors and outdoors with respect to the school board issues and concerns. If we are going to be seriously committed to the use of masks and the washing of hands and the social distancing, it's bad enough that we have children that come in out of circumstances where this might not be going on, that we build into our provisions a situation where we could add to the risk that comes into the campuses. So I'm simply going to ask that they wear a mask whenever on any school board or Manatee County property, facilities, transportation, vehicles, including school buses. And I know that sounds draconian, but one thing that I have perceived from all of the input that I've gotten is that people are genuinely afraid. And they have a right to be. And if we're going to stick with the premise that we're going to try to make schools as safe as possible, then that means indoors, in rooms, outside, on the playground, wherever. And so I'd simply offer that up as a suggestion. We said masks, we mean masks, and that's pretty clear, that cover the nose and mouth to help prevent community spread of this virus. This helps that. I don't understand how we can say we're really trying to make a difference to the community at large, and then we bring children onto our campus and then demand in the classroom that they wear masks, but when you go outside for recess, not a problem. That to me is a bridge too far. If we're going to do it, let's do it. And I've supported that, and I still support that. It's inconvenient, it's difficult to do, it's hard to enforce, it's all of that. But until we get a permanent solution to this problem, we all have to. We will be saved together. We need to suffer together. That's all. I don't enjoy sitting up here like this, but it's best. It's best. That's all. And I don't know whether there's an appetite for that or not, but
Madam Chair?
Are you?
yes, I am, Madam Chair. I'm sorry.
Dr. Hopes?
Yes, ma'am. In reading it, I'm really not comfortable with making changes. I think that we can certainly define face coverings, and I think we have. If we just say mask, we're getting into, what's a mask. I think it's fine, and I don't know whether Mr. Kennedy had changed it, but in the second paragraph from what was emailed to me, in the first sentence, it does say students wear a face mask. So I don't know if that was changed or that's in the original text. So we have discussed face coverings, and that is the language from the Department of Health. I think it's important that the various codes and et cetera are listed. I do think that we can provide definitions as we move forward. with regards to what constitutes an approved face covering, and you know, with regards to shields, that is a splash shield. It's not really considered a face covering in the context of CDC and the Department of Health as they have finally defined it. So I think, you know, we're getting the message out. If we want to, I like the language that we have. I think we make it clear of what an approved face covering is, and that it is a mask, a cloth mask, or et cetera. And I do think, Mr. Kennedy, that the various codes that are referenced do need to be in there. And I think it needs to be as broad as possible, because in situations, if children are playing outside or children are gathering in outdoor corridors and are not socially distancing, they need to wear a mask, whether they're in the building or not. I suspect when we observe the transition from the bus drop-off and the car drop-off, as much as staff may work hard to ensure that there's adequate social distancing, I can't imagine that we will not run the risk of students getting closer with one another. So I don't think we need to restrict it to inside the buildings. I think the language is broad enough that we can enforce policies as we continue to get definition from CDC. Thank you, Madam Chair.
Thank you. Mr. Titlebaum, did you have something you wanted to add?
Madam Chair, thank you for the moment. I'm agreeing that we must leave in the other languages that are contained within the statutes. You have the broader scope of or engaged in other school activities that allows you a broader scope within the mandate. In addition, the other applicable laws are for the protection of the district from a legal standpoint. That's it.
Thank you.
Thank you.
Okay, I have 2 board members waiting to speak, but I wanted to make sure I gave everybody an opportunity to speak. Mr. Minor, is there anything you'd like to add to this?
Not at this time, Madam Chair, thank you.
Okay. Just so we have one go around, I'm hesitant to approve either one of these. And I will say why. And I agree with Dr. Hopes, it should be more broad. So if I were to support one, it would be the one that's currently there. And that really actually comes from the CDC and the CDC guidelines and the CDC adoptions that we need to focus on. And some of the examples they give are people that are deaf or hard of hearing. We have deaf education classrooms. There are younger children. One of their exceptions, one of the things that they say that we need to adapt for is for younger children that may be unable to wear a mask. And it says preschool or early elementary age. It says engaged in certain activities where they might become, where they're high intensity, like running, that can cause health concerns. And these are straight from the the CDC guidelines. So I don't want to make it so restrictive that we are once again not following CDC guidelines. I would like to make sure that we are keeping everyone as safe as possible. But as I said the last time we talked about masks, masks are not a silver bullet. There should be an entire program about cleaning schools, cleaning hands, distancing, training of our employees. It is a comprehensive program that we should be focusing on, and that is what I truly believe we should be. That should be our focus. And so I would be really hesitant to support the one that was handed to me tonight. I'm still undecided on the one that is up there. But that's just my 2 cents on that. Vice Chair Kennedy.
Thanks, Madam Chair. Yeah, I, after hearing from Reverend Golden and Dr. Hopes, will concede that indoors probably needs to go. I think that's wise. And I understand about CDC guidelines. The problem that we have been experiencing since July 14th, however, is that there is confusion from what the board said that night, which initiated with Dr. Hopes and the conversation about face shields. But up until July 14th, we had been using mask and face shield interchangeably. And so that is what went out on our guidance. So if you look at our website right now tonight, it says that face shields are an acceptable face covering. And I don't think a board majority believes that is a proper face covering. And so I think we need to be, school is starting in 6 days. I think we need to be really clear tonight what our expectation is, instead of saying, well, we're just gonna have to check in with the CDC website every morning to see what's appropriate. So I think to say, and we can add a few words here and there, and I'm fine with bringing back the legal, the statutes and codes on the bottom, that's fine. But I really want to, personally, I really want to be clear for especially our employees and for our students about what our expectations are when they arrive on Monday. So I think leaving any room, and granted, we're not experts, and this is only a 90-day policy, so we're going to have to come back and do this potentially in 90 days. It's just an appeal for clarity, board members. That's all. This kind of like being wishy-washy about it is exactly the problem that we've had for the past nearly a month. And what I was hoping to do with this policy is remedy that confusion and be crystal clear. So that's where I stand. Thanks.
Reverend Golden.
Thank you, Madam Chair. I have been trying to glean from what I was just handed that which constitutes the original policy and that which is recommended as changes. And I agree with you wholeheartedly that the changes don't make this any better. But given the language that has been stricken, we don't really have a full sentence in paragraph 2. It says, therefore, in order to implement immediate mitigation measures during this pandemic, the school board hereby mandates that all employees, visitors, and students wear a face mask, period.
No, that period is struck.
Well, if the period is struck, then it really doesn't make any sense, because what you say is wear a face mask, other approved face covering while.
No, that's struck too. That whole period, and then what the phrase you just read is all struck through.
Okay, is that struck through the existing policy? That's what I'm saying. I'm reading the.
Oh, I'm sorry. No, it's not. The strike through is mine. The green words are what I added. The strike through is what I'm deleting.
I understood that part. What I'm trying to share with the chair here is the necessity to at least create a complete sentence to address what you're talking about, not being so strict that we can't have anything else, and yet not being so ambivalent that it has no effectivity. That's what I'm trying to address, if I might continue. It says here that the school board hereby mandates that all employees, visitors, and students wear a face mask, period. That's what's in the policy. What we're concerned with is how to address, as what was put in the first paragraph, face coverings. And my suggestion would simply be that not in addition to, but wear a face mask along with any other approved face covering, because that is what is really the issue, that we are not saying just mask, and we are not saying only additional face coverings, but at least the mask. That's what we mandated. And they can wear that mask along with any other approved face covering while on school property. And I appreciate the Vice Chair, who says that indoors is not proper. I think we all agree on that. So if we're trying to provide maximum flexibility to people and yet maintain the integrity that we have with respect to the need for masks, you don't put it in an alternative. You put it in as an adjunctive is what we say. And that, other than that, I have no problem with the policy. And I hope that helps you in terms of being able to say, you must have a mask, but you're also allowed to have any other approved thing.
See, that's how I read the current one that is coming before us, not Mr. Kennedy's edit.
No, I know.
But the current one, that's what it says. It
What?
says you need to have a mask or any other approved
But
face
see-
covering.
But see, the word "or" is not there.
Right.
That's true.
So I'm, okay, if you,
That's funny that you say that. The word "or" used to be there and it was edited prior to its arrival on the agenda.
okay. But then, if you use the word "or," what you have created is an alternative. You can wear the mask or. And what we're saying here is that you must wear the mask, but you can also wear any other approved face covering. That's what you're really driving at here. Not that you have an alternative between wearing a mask or wearing something else, but that you must wear the mask. And all of the other conditions you're concerned with are contained, as Attorney Teitelbaum has lifted up, in the policies and procedures and all of the rules and regulations. No kid under 2 years old has to do it. All of these other exceptions that are outlined are exceptions that are recognized within the existing law. Our policy here is simply that we are saying you must wear a face mask. We decided that, we voted on that, but in addition to that, you can wear other approved face coverings. And the word that we are arguing over here, as is always the case in law, is the word "or." And we're not saying "or" here. What we're saying is you must wear the mask, and in addition to other face covering, approved face covering, because that's the broader language that allows shields and all the other things that are attendant to what the doctors will permit, that kind of thing. Thank you, Madam Chair.
Madam Chair,
Dr. Hopes?
let me try this, and I appreciate the conversation. I think the first paragraph should be left as it is because it's referencing what the Florida Department of Health recommends.
Yes.
And I think by putting in a mask that covers the nose and mouth, unless the Department of Health has said that, we should not, tinker with their language. Where it comes to what we've been talking about, I think this may help. And that would be in that first sentence, students wear a face mask, comma, respirator, because an N95 mask is actually referred to as a respirator, or other approved face covering which provides filtering of air covering the mouth and nose. And what that would provide for is it would also provide for a type of mask or respirator that has an eye shield attached to it. So it's not a face shield, it's a type of mask that has an eye shield that's built into it. And by inserting the language that it must filter the air, that eliminates the issue of a face shield without a mask.
Vice Chair Kennedy?
Yeah, I just wanted to be clear about, I think I know the answer, but I just want to be sure. Mr. Teitelbaum, the language at the end of paragraph 2 that you suggested we bring back, and I'm certainly fine with that, that language is what brings in a medical exemption or an exemption for an IEP?
Madam Chair?
Please.
It's protection for the particular district, so we don't violate civil rights of those that would have disabilities as well as seeking appropriate medical accommodations that must be still approved and be consistent with the policies of the district.
So yes.
Yes, it's protective language. It's really the language. You can't say you can eliminate the ADA itself, but ADA accommodations, Mr. Kennedy, are not absolute. There's a process to an ADA accommodation. If there is a particular disability, if there's limitations, are they permanent? Are they temporary? Is there any accommodations that can be had that would also keep the health, safety, and welfare of everybody that's involved in the particular district?
Thanks, Mitch.
Thank you,
Yeah,
sir.
no, I just want to be clear because we have, when we've gone over this mask policy before, we have mentioned as a board that we want to have a waiver, a medical waiver if a doctor will sign off on it. And obviously we want to have a waiver, a mask waiver if there's an IEP, if it's spelled out in the student's IEP that they don't have to wear one. So that's there, thank you. And I'll just make a final plea for simplicity because you know, which is what I was trying to get at here with my changes, again, in green. I won't read the whole top of the sentence, but recommend that everyone wear a face mask that covers the nose and mouth. Okay. Second paragraph, therefore, in order to implement immediate mitigation measures during this pandemic, the school board hereby mandates that all employees, visitors, and students wear a face mask when on School Board of Manatee County property, facilities, and transportation vehicles. And then period. Well, I guess if we're going to bring back the language, then that sentence continues on. But I just think simple is better. And because there's already so much confusion out there, and if we leave any room for wiggle or for arguing, we are just going to create problems on our school campuses that we could easily avoid by trying to finesse this. Like, let's just be short and sweet and clear, and I think it'd be a huge help to our staffs. Thanks.
Aaron Golden?
Dr. Holtz, I'm inclined to agree with Mr. Kennedy here, because by eliminating the other approved face coverings from the policy, it does not prohibit any other thing that you can wear. The policy is directed at requiring you to wear a mask. So if you can wear a mask and can wear a shield too, that's well and good. So I'm satisfied that the language of wear a face mask while on school property, facilities, transportation, I'm happy with that, to support that, because it does not preclude you from doing any other thing that a doctor requires you to do, or doing any other thing that helps you to feel safer. It simply says whatever else you do, you got to have on a mask, and that is all that we had addressed.
And I agree, that's in the original language. That's why I don't think we need to change the second paragraph, because it says a mask.
Well, I know, but the stricken part says other approved face covering.
I'm okay with striking that, just leaving it as a mask.
Yeah, that is there. That is in the original. See, that is in the original
Right.
policy.
Just put a period there instead of a comma, and we're done.
Yes.
You don't need to change anything else.
Well, then you have an incomplete sentence.
Well, our mask, I would get rid of the indoors. Just leave the language as it was. Just strike other approved face coverings.
That's what I said. I'm sorry. I
don't disagree with you. That's
okay. Yeah. That's what I said. That's fine.
Leave it, as a mask in that second paragraph. And if we wanted to put something else in there, it should be a respirator and a face covering that provides filtration of air. But we don't need to put that. I'm fine with just a mask, and then we go on to school property, facilities, and transportation.
Yes.
I mean, it's as simple as that. Just delete other approved face coverings, and that's it. And then leave while.
Yeah, while on school property. Okay. Do I still have the floor?
Yes?
Okay, I'll try. I move that policy 8450 be approved in its current.
I believe there's already a motion and a second, but you could amend it.
Oh, there is a motion and a second.
I believe so. I believe you were the seconder.
Vote on that motion and then go back to the motion that Mr. Reverend Golden's going to make.
He said he withdrew his motion.
I believe Mr. Minor's the one that approved the motion.
I made the motion.
You made the motion.
I think you can just amend it if you'd like to amend it.
Well, then I amended that paragraph 2 be amended to simply read from the portion that says face mask while on school property, facilities, transportation, and or
I'll
engage.
second that amendment to the amendment.
Yeah.
So for clarity, you're going to remove the words other approved face coverings
That's correct.
and the period after mask, obviously,
Yes.
so that it's correct.
While on school property, facilities, transportation, and or engaged in school activity. The rest of it flows through.
Okay, there's been a motion and a second to approve the amendment to policy, the amendment to policy 8450. Is there any further discussion? Vice Chair Kennedy?
Maybe instead of like doing multiple motions to amend, because I still would like in the first paragraph, board members, the change that I made is in green, again, cross out the word,
Fine with that. Fine with that.
cross out the word covering and insert, quote, mask that covers the nose and mouth. And then it goes on to help prevent kids, blah, blah, blah.
And I don't.
Do you accept that as an additional amendment?
Well, I don't want to be a stickler, but I want to know if that is exactly what the Department of Health recommended.
Right.
Did they use that word covering, or did they use mask that covers the nose and mouth? See, the sentence says, as part of emergency procedures to be implemented by federal, state, and local officials related to COVID-19 pandemic, the Center for Disease Control and Prevention and the Florida Department of Health recommend that everyone wear a face covering. Now, if they didn't recommend that, I don't have a problem with mask that covers the nose and mouth. But if they did, then we are saying something to the people. We are adding to the confusion that the people already have, because we're telling them that that's what the Florida Department of Health recommended. They didn't. And that still doesn't take away from the fact that in the second paragraph, in this county, in this school system, we said masks, period. No ifs, no ands, no buts about it. So you can't parse it and slow drag it. That's when I used to dance. That's what we used to call it. You can't do this kind of stuff. You're either going to do it or not. If we're taking the recommendations as the basis for what we're doing, the recommendation said face covering. And what we have said here to the people in this county, to protect them, we're not going to be vague about face coverings. We want masks. And now we've agreed, at least I thought we had, that on school property, facilities of transportation, and or when engaged in school activities.
Madam Chair.
Dr. Hopes?
I think I've probably seen enough from the CDC and the Florida Department of Health that they are now talking about masks that cover the mouth and the nose. So I'm okay to make that change that Mr. Kennedy has inserted, as long as all the rest of the language in the first paragraph stays. And then the second paragraph to include Reverend Golden's edits of deleting what he mentioned, and I think we're good to go. And certainly the Manatee department of the Florida Department of Health has made it clear that masks that cover the nose and mouth are what's required.
On that representation, then I withdraw the objections that I've had. So,
thank you, Reverend.
You're welcome, Doctor.
Okay, so now there are two amendments to the amendment. Two changes in the amendment to the amendment. I'll clarify that. One of the changes will be that the Florida Department of Health recommends that everyone wear a mask that covers the nose and mouth. And the second change will be other approved face covering with that period at the end of face mask will be removed.
That's correct.
Those are the two amendments to the amendment that you have made the motion, and I believe Vice Chair Kennedy has seconded it, or is it Dr. Hopes?
I think I did.
Dr. Hopes did. Okay, I thought so.
All right.
So we have before us two amendments to the amendment, so we're only voting on those changes. If there's no further discussion on those two changes, Mr. Minor?
Madam Chair, this starts out with a statement, which I believe is true, that the Florida Department of Health recommend that everyone wear a face covering. Is there any dispute about that? I think that's what the Florida Department of Health says. You know. Now, if we're going to mention the Florida Department of Health,
Can you
I
sit
think-
in front of your microphone so we don't get some
Yeah.
feedback?
yeah, I apologize. If we're going to include something that represents what the Florida Department of Health has recommended, I think we need to do it accurately. And I think accurately, the Florida Department of Health has recommended that everyone wear a face covering. Is there any dispute to that?
If that's a question, Madam Chair,
That's a question I'm asking of my colleagues.
yeah, well,
Is it,
one of your colleagues just said, Mr. Minor, Attorney Minor, that the Florida Department of Health and the CDC have evolved in their language from face coverings to face masks that cover the nose and mouth. He just said that less than 2 minutes ago. And we have accepted that as, I don't want to say true, but we've accepted that. And we seem to be going round and round here, Madam.
okay, well, Madam Chair, I think that Dr. Hopes is the larger authority of us with respect to what the Florida Department of Health is recommending. And Dr. Hopes, can you confirm that the Florida Department of Health no longer says that everybody is no longer wear a face mask, but the department has recommended that everyone wear, or it's no longer a face covering, but wear a face mask?
Yes.
Okay,
Mr.
great.
Minor, I have heard that, and it's also been spoken in press conferences with the Department of Health and the governor that they are saying wear a mask.
Okay, well then I'm all for recommend that everyone wear, that this language include, the Florida Department of Health recommend that everyone wear a face mask that covers the nose and mouth to help prevent community spread of this virus, period. And that would be, and we end our first paragraph right there. We don't need to talk about the executive order or everything that's underlined. Just keep, that shortens it up, makes it a little bit sweeter. With respect to paragraph 2, that Board Member Reverend Golden had visitors, therefore, in order to implement immediate mitigation measures during the pandemic, the school board hereby mandates that all employees, visitors, and students wear a face mask when on school district property.
We brought back while, Mr. Meyer.
Okay, while on school district property, in facilities and transportation vehicles, including school buses. I have no problem with that language, if that's the language we're considering adoption.
I believe for the most part, except for the rest of that paragraph in the first paragraph, under the current amendment to the amendment, the motion that's on the table, it is still there.
I'm sorry, Madam Chair, I didn't quite understand it.
You suggested striking through the final part of that paragraph.
The paragraph 1.
The copy you're looking at
Yeah,
is the copy from Vice Chair Kennedy.
right,
That is not the copy we are operating from.
okay,
The copy we are operating from is the copy that was put in our agendas.
okay.
In the copy that we are operating from, we are not striking through the bottom portion of that first paragraph. What is on the table right now is an edit to face covering and an edit to the first sentence to remove the words other approved face coverings. Those are the two amendments. It is not, we are not working off of his copy, we are working off of what was posted to the board work.
Okay.
Is that okay? I just want to make sure we're all on the same page. And I know his strikes through that, but Dr. Hopes has just suggested not striking through that. So right now what's on the table is those two changes that I mentioned about face covering changing to face mask and striking through those other approved face coverings.
I have no problem with doing that. I don't think it had been discussed taking out language in the first paragraph that starts talking about the emergency order. I don't think that's really relevant or necessary.
Okay. Is there any further discussion on the amendments? The amendments. I don't agree with these amendments. I don't think that they really follow what we told the parents, what we told the teachers. I don't think it really follows what the CDC says. CDC specifically says about reopening schools and within classrooms that teachers of young students will need accommodations. Teachers of students that teach English as a second language will need accommodations, and teachers of students with disabilities will need accommodations. Once again, teachers that are teaching deaf or hard of hearing students will need accommodations. That's on top of the other medical accommodations, and I don't think that this really fully addresses all the needs of our students and our employees. So I do not agree with these amendments. But with that, we will call a vote for the amendment to the amendments. The amendments to the amendment. I should put the S in the wrong place there. As we've already stated, it will be changing the first paragraph, so it'll say face mask, and the second paragraph, it'll say other approved face coverings will be removed. All those in favor, please signify by saying aye.
Aye.
All those opposed?
Opposed?
Nay. So it passes 3-2 with Dr. Hopes, Reverend Golden, and Vice Chair Kennedy voting in favor, and Chair Messenger and Mr. Minor voting nay. We are on now to the amended policy 8450. As we have just amended it, is there any further discussion?
Madam Chair, this is the,
Yes.
this is the change to the first paragraph now that we're on?
We have just changed those things that we just talked about. So now it will say mask in the first paragraph, and we have removed the words other approved face covering. Those have been changed. We just approved those changes. Now we are on to approving this as it has already been amended.
So we are, just to be clear, Madam Chair, I'm sorry. In the first paragraph, we are changing that to say, Department of Health recommend that everyone wear a face mask that covers the nose and mouth?
Yes.
We included that, okay, just want to make sure. Just want to make sure, thank you. I thought we were voting on the second paragraph, but if that was included in that.
No,
what we
I
just-
said both.
Okay, thank you.
Absolutely. Is there any further discussion? Hearing none, let's vote. We are on to policy 8450. We've already had a motion and a second on this. All those in favor, please signify by saying aye.
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 All those opposed, nay. It passes 4-1 with messenger dissenting.
Madam Chair, before we move on, I'd like to make a comment for the public on this. And that is that in the past couple of days, the CDC has come out with additional guidance, which I identified in 2003, and that is they are not recommending that individuals wear masks that have a vent in them. And the reason for that is that vent that's in the mask allows you to exhale unfiltered air so that it protects the wearer, but it does not protect other individuals from the wearer. So I'd just like to make that note that parents should not be sending their children to school with masks that have a vent on them. All that does is if there's virus, it just blows it out like a trumpet. Thank you, Madam Chair. And finally, the CDC has issued a statement on that.
I think that's a great visual. Blows it out like a trumpet.
It does.
Talk about music.
Mr. Minor and I have experience with trumpets, right, Mr. Minor?
Yes, we have.
Vice Chair Kennedy, you signed up to speak.
Oh, sorry, I forgot.
You're just button happy over there.
Thank you.
All right, friends, it is almost 9 o'clock. Would we like to take a break or would we like to keep moving forward?
Press on.
Press on?
I'm good with power through.
Okay, me too. I just want to make sure everyone's okay on the same page. Okay, let's move forward. We are on new business, no superintendent recommendation, and it's item number 1. And I believe this is brought forward by Mr. Kennedy. Mr. Kennedy, would you like to make the motion on this?
I sure will. Board members, I would like to make a motion to approve. This is a. Oh, this is a notice to advertise. Actually, Madam Chair, I'd like to change this up a little bit. I'd like to make a motion to approve a temporary 90-day policy regarding a temporary work from home policy for employees. So, Madam Chair, oh, sorry.
Is there a second?
Second.
Okay.
May I?
Sure.
Okay, thanks. What board members, what this is on your agenda is an approval to advertise, but instead of advertising it, just like we just did with policy 8450, I would like to enact this tonight as an emergency policy, which we're allowed to do, and it's in effect for 90 days. So, board members, attached to your board work, I have taken a template that I, quite frankly, borrowed from the University of San Francisco, short and sweet, what it does is if an employee's supervisor approves of them being able to complete their job and work from home, and there's conditions included, as in like you would need to be available to your job during regular work hours, that with that approval from their supervisor, that employee could work from home. Then you'll see in the board work there is a temporary telecommuting and remote work agreement, which is attached. The policy text I have changed to speak to the School Board of Manatee County, but if approved, we could adopt that same temporary telecommuting and remote work agreement. That agreement would be between the employee and their supervisor. Again, this policy is really aimed at, for example, employees that work here at the PSC or excuse me, at the SSC or the PSC. Obviously, school-based employees need to be at their school serving our students. But what I wanted to get to here is that anybody who can possibly work from home should be able to go to their supervisor and ask for the ability to work from home.
Okay. Is there any further discussion on this? Okay, well, I don't see any others, so I will go. I do not support this. I think it sends a really wrong message that we're saying, hey, teachers, you need to go back in your classrooms, but everyone else working in this office, you can go home. I just think that sounds like a really wrong message to our teachers. If I was a teacher, I would find that offensive, that I'm saying, we're going to open it up for everybody else, but you can, so I cannot support this.
Do we have a motion before us?
Yes, Mr. Kennedy made the motion and Mr. Minor seconded it. Is there any further discussion? Mr. Minor.
Okay, Madam Chair, can you go into a little bit more of your discussion or argument that allowing this temporary work from home policy to have a negative effect upon teachers, as opposed to providing, flexibility, for employees under certain conditions where temporary work from home would be advantageous to all concerned?
I believe it would provide flexibility to other employees. That's not my argument. My argument is we're not allowing that flexibility for our teachers. We're saying we need you here, but we don't need Joe and HR here? I mean, it just sends the wrong message. We are all a team and we all have to get through this together. And we can't say, sorry, Joe from HR, you can go home. But Betty that's teaching second grade at Bayshore Elementary, you gotta come. It just sends the wrong message to me. And I don't wanna be part of that, that's all.
Madam Chair, I want to appreciate your educating me a little bit more about this. And you're saying, Betty could not communicate and have temporary work at home for kids at home, or no teacher would be eligible to come into having the benefits of this. That is, do I understand you're saying that?
I believe that, as Mr. Kennedy has stated, his intention is for employees that are not working at school sites.
No. Can we have maybe the superintendent weighed in on this? Is it, does it exclude, teachers, from having, benefit from this policy?
I believe the motion was only for the supporting facilities, not the classrooms or the schools. Some teachers are able to work remote if they're an e-learning teacher, but there aren't very many positions for that. So yes, if there are students in the building in schools and their position is teaching the students, then they're being required to come in. This one is just stating that the support building, this building, PSC, etc., would have the flexibility if their supervisor approved it to work from home. That's what the proposal is.
That's not quite right.
Okay.
It's close, but not quite right. Madam Chair.
Yes, Vice Chair Kennedy.
Thank you. The bottom line for me on this is, if we're going to open as safely as possible, any employee who can complete their job requirements from home should be able to do so. I realize it's, some people may look at it as unfair, but as I said at the top, some people's job requirements require them to be at school. For an e-learning teacher, for example, and Superintendent Saunders, this is what I mean, you're not quite right. In my motion didn't say anything about the SSC and the PSC. I was just using that as an example of where there's probably a higher number of employees that can work from home. But for example, an e-learning teacher who has 100% of his or her students online, if they can complete their job from home and their supervisor approves of them working from home, they should be able to do that. And I realize that's a benefit to e-learning teachers over those that are doing hybrid or brick and mortar. But it's just about opening in the safest way possible. And if one is able, they should be able to work from home. And that's what I was going for here with this policy. That's it.
Reverend Golden?
We just approved a policy that requires everybody to wear masks. And now we're being asked to consider a policy, except if your supervisor can make arrangements where you, the job, are well suited to such an arrangement. And I just, I don't understand that. I really, I'm just kind of a mindset here that we are spending a tremendous amount of time trying to create the illusion of safety and security. And that's just not what's happening here. This virus impacts everybody. And the idea that we would contemplate creating situations where people can stay home and be safer, that's just not real. We are in danger, even us sitting up in here tonight with all our masks on, with all of the social distance that we occupy. We are in a dangerous time and in a dangerous place. And we're spending all of this effort. And I don't know whether we're trying to pacify each other or mollify each other's fears. I'm just not quite so sure what the motivation is here. But the reality is that we have created as safe an environment as we can create that puts everybody equally at risk. We talk about doing stuff safely. There is no safely. We don't have a vaccine. All we're trying to do is modify the risk, and I don't think that the risks should be modified to favor those who happen to be in a position that would allow them to work from home. That's just not fair to the people who have no choice. I don't. To me, it's an issue of whether it's fair or not, and I just don't think it's fair. If you want to work in the school system in this county, you assume the risks that everybody assumes. I'm at risk. I'm over 65 years of age. When I come in here, I'm at risk, but I do it because it sends a statement. It says something. And if you aren't willing to make that statement, well, maybe that might be part of what the problem is and not the solution. We need a vaccine, period. We got to stop fooling ourselves that anything less than that is going to make us any more or less safe. We are all at risk. And 150,000 of us have died from the risks.
Is there any further discussion?
Madam Speaker, Madam Chair, could we ask the superintendent to respond to Mr. Kennedy's understanding of this proposal? I think there's benefit if approved and it, by a superior for some employee, to be able to work from home and still, perform what that supervisor feels is appropriate and necessary, whether it be a teacher or anyone else, that that should be an opportunity available, in our policies. I have great respect for Reverend Board Member Golden, but I have great respect, for, one of our members, appearing here, from home and doing a great job. And I don't see that as a negative effect. And why should something that's good for a board member not be available to employees? That's where I'm coming from. And if it's approved by you know, Board Member Hopes doesn't need the approval of anybody. You know, he has a judgment about what's best for the situation. But in here, we have that limitation of it has to be approved by a superior, if I understand it correctly. And in appropriate situations, why should not we allow other employees to have that right, if that's really what's intended? And that's how I think that Board Member or Vice Chair Kennedy interprets this. Yeah. Could we have the superintendent?
If you're asking me a question, I will tell you in our MOU
Yeah.
with the union,
Yeah.
the e-learning teachers are permitted to work from home. Right now, that is the only classification that has that allowance. So the policy that Mr. Kennedy is bringing before the board tonight, if passed, it would give other classifications of workers that opportunity if they're supervisor approved.
Okay. What's the downside of that?
Those are decisions for the board. I think Ms. Messenger had her opinion. Those are just decisions that the board, you know, need to weigh and determine what you feel is the, you know, and the best for conducting business for the district.
Okay, thank you. I have no further questions.
Reverend Golden?
The policy is written, says suitability for telecommuting or remote work is based upon the individual employee as well as the employee's position and is to be determined by the employee's supervisor. And what that says to me is that we're creating a recipe for about as much bias and discrimination and about as much prejudice as you could experience in something that has such consequences as that. The supervisor over at the transportation department comes to a different conclusion about the supervisor over people over food services. The supervisor at this particular center over human resources comes to a different conclusion than the supervisor of IT. And all of that's, and you don't like the outcome, so now you appeal to the supervisor. I mean, why are we allowing ourselves to build the seeds of discord, to build in the seeds of discord into our policies? The real truth of this is that we are all at risk. And you are absolutely right about one thing. Dr. Hopes chooses not to come, and that is his decision that he doesn't have to ask anybody about doing. I choose to come. Nobody forces me to come. That decision was made when we got elected. Now, everybody else in this system is hired. And I just think it's unfair to create amongst the people who are hired to do the work that we are asking them to do, albeit dangerously, and nobody's saying that we are insensitive to this. But we'll wind up with 10 people coming before us saying, my supervisor wouldn't let me work at home. That just, in a time like this, that just seems like an unnecessary burden for us to have to bear. So, the sentiment is well thought out, but the execution of it creates more problems than they solve. These are the unintended consequences of the decisions that we make.
Vice Chair Kennedy.
Thanks. Reverend Golden, I just want to correct you on one thing.
Okay, I'm sorry.
No, it's okay. But you just said yourself, it is determined by the employee's supervisor. That's it. If the supervisor says no, there's no appeal to the next level supervisor or to the board. It's just if that his or her boss says they can do it, and then if you look at the bullet points below, they've got to be available, they've got to have a working phone, They've got to maintain business hours, so on and so forth. That's it. It's just, if the boss says no, then you're out of luck. And I'm sympathetic to the, different job classifications would be treated differently. But like I said, if we're going to open as safely as possible, if there's any way that, and even if it's 5 employees out of our 7,500, if those 5 can work from home and that gives us a little bit higher degree of safety, I think that's a good thing. So that outweighs the quote unquote bad feelings that would be created. That's it. Thanks, Madam Chair.
Is there any further discussion?
Madam Chair.
Dr. Hopes.
First, because a number of things were mentioned. First of all, I think that the chair is right that we, and Reverend Golden, we set up a situation for disparity. And I guess the problem that I have with the motion is that we have a superintendent who is the CEO of the organization and is responsible for the day-to-day management and operations. And I don't think it's fair to the superintendent to come up with a policy, not an advertisement for a policy, but a policy that could put her in a very difficult position with regards to managing the operations of the district. With regards to my not being physically present, I am recovering from very aggressive surgery on the inside of a part of your body, which makes it very difficult to sit. And I will tell you, I'm recovering from 7 incisions, internal incisions in that area. The good news is I have no cancer, but I am anxious to get back. But looking at the agenda, I did not feel that I would be physically able to sit on the dais for now going on probably 4 hours. So it's not my concern for the infection. As you know, I did attend meetings before I had my surgery on the 15th. But at any rate, that's why I'm not there. I'm with you in spirit and telecommuting, and I'm looking forward to the last 2 weeks of my recovery and then rejoining my colleagues. Thank you, Madam Chair.
Is there any further discussion? Okay, hearing none, I will call the vote. And Mr. Kennedy's motion was approval of the policy, not the advertisement, approval of the policy for a temporary work from home policy for employees. Am I correct?
You are correct.
Okay. It has had a motion and a second. All those in favor, please signify by saying aye.
Aye.
All those opposed? Nay.
Nay.
The policy fails. There are 2 voting in the affirmative, Mr. Minor and Vice Chair Kennedy, and Reverend Golden, myself, and Dr. Hopes are dissenting. We will move forward. The next one is options for COVID-19 rapid testing at the board's request.
Question,
Yes.
if I may. Is the, I apologize, I was thrown off by options. So is the objective here to listen to the options and then approve a motion right now?
Truthfully, I do not know what he's going to present, but I thought if we heard something that we thought we could move forward with, then I would expect someone to make a motion if they found something that they thought they could.
Okay, just want to be clear. Going in, thanks.
Yeah.
Okay, good evening. You are correct. Thank you for having us back, and this is a request from the board to give options of kind of actually an overview of some of the things we're doing and then some options at the end. Now, we can make this as short as possible. We had lots of discussion prior where we talked about the testing options that are out there. So
I would prefer short, seeing as it's already
Short.
9/11 and we have several more items to get to.
I would agree with
If
that.
the board is okay with that.
Absolutely. We can do short as well, short and to the point. Just to introduce a few people we have up here. We have Bill Kelly, he's our Director of Risk Management, and also Tracy Moore, she's our Benefits Administrator. I just have 11 slides that we can go through. COVID protocols, some things, and many of these things have been discussed tonight. We've already talked about those. Bottom line is, we want everyone to wear a face mask, of course, and also to adhere to social distancing. Wash your hands, and if you're sick, we need you to stay at home. Some things that have happened since the last time we spoke, however, we've instituted, the DOC, which is the District Operations Center. It's staffed by the Department of Health officials and district leadership. And epidemiologist has been identified to work with us here in the school district in this building starting this week to help with COVID type questions. So they have contributed that person, that resource that will be here helping our district go through as we open our schools. We may have lots of questions coming our way. Some things that we are doing. Attestation. So we're asking employees if you've had symptoms. Have you been exposed? Have you been around people? We're doing this daily. It's an interactive. It's going live. We're going to do that with the students as well. There's no cost to this. It's on track for implementation. It's also going to be on your computer screensavers for all district employees. Temperature screenings. We've been doing this for a couple months now. All employees are getting their temperature screened, and we're going to do random temperatures for students as well. This was a document that was provided to you. Really, it's from the FDA, Food and Drug Administration. It really just talks more about diagnostics test and antibody test, and we're not going to go through that because we are pressed for time, but that is in your handouts as well. And it's on the website. Getting to the nuts and bolts of it, COVID testing options. And again, we went into a lot of detail on this last time, but just a refresher. So what you have here is the 3 areas. The PCR is probably the most common that people have heard about that we have here. We've had it free testing for PCR. That's one of the diagnostic tests. There's also the antigen test, which is not here at the free sites as of right now, and then also the antibody test. And again, we went into great detail before on those. Bottom line, if you're looking for a diagnosis, it could be the PCR test or antigen test, and if you've already had COVID and you want to see if you have had it in the past, it's the antibody test to see if that's in your system. Mr. Miner had talked about, asked prior about the free testing sites. They're on our screen. What's new today, first time ever in Manatee County though, is the antibody test. It started today. It was at Lincoln Park. That's the first time that we've seen the free testing. But again, the PCR testing is readily available. Many of us drive by these sites and you can see how few people are in them now as we're going through the year. Which was not the case prior, and we're actually seeing results coming back very fast. So what are we recommending? The short. Employee attestation, we've got it. We're continuing as planned. We're implementing it. It's temperature screening, we've had it. We're going to continue with it, of course. The PCR testing, obviously, it's free. There's many locations. If someone wanted to get tested for COVID right now, they could go to the free site and find out if they have it. Antigen test, it detects the proteins. It's very accurate, but it has negative. So sometimes if you have a false negative, meaning they say you're negative, it has a high probability that maybe you're positive, and that's one that's an issue with the antigen test as far as the diagnostic. And the antibody is one that you're seeing, you may have read about in the news. Lake County implemented that for their employees. They've had 3,000 employees take the test. It diagnoses if the antibodies are present in your system. So you may have been exposed, you may have had it mildly, you may have the antibody in your system and you don't know it. You may be wondering that I had a loss of taste, a loss of smell. I'm feeling that maybe I did have it, and I can get the antibody test to find out if I had or not. None of the tests, of course, are 100% accurate.
but those are really our 3 tests, and we're recommending the antibody test. Tracy, do you want to talk a little bit on this one? Let's say you approve tonight or in the future to go forward and hire a company to do this. There's standards. We've talked about the CLIA standards. You heard about it the last time we presented. It meets laboratory improvement amendment. It's something that's a standard that's used by testing agencies. And there's also verified by the Florida Agency for Healthcare Administration. So if you were to go forward with something, it would be an RFP type situation where you would have to go out for bid, and we'd have to have standards that the testing agencies would have to rise up to before that they were given an award to go forward with testing. So what are we recommending? The antibody testing. Go ahead, ma'am.
Reverend Golden?
Yes, thank you, Madam Chair. The antibody testing shows whether you've ever had it.
Correct.
If you've ever had it, does anyone know whether you can get it again? No. Somebody speak up here. Let me find.
So there's not enough testing to prove that you cannot not have it a second time.
Madam Chair.
Okay. Dr. Holmes, did you want to help answer this?
Yes, sir.
Okay, because I think it's, let me stop being subtle. If I've had it and can't get it again, the antibody test will show that. If I've never had it and don't have it now, I will not have any antibodies.
That's correct.
Is that correct? And if I've got it now, whether it's, what's the magic with it? Whether it's asymptomatic or not, if I've got it, the antibody test will that detect that? It won't detect that.
Madam Chair.
Okay, I'm sorry. I'm talking to the lay people here, Doctor, and so maybe we'll all learn something now. Go ahead, Doctor.
So with regards to the antibody test, the first thing is that if someone has been infected, if you have been infected with the SARS-CoV-2 virus and you are symptomatic, antibodies, IgG and IgM antibodies start to show up in your blood around the 4th, 5th, 6th, 7th day. Those antibodies continue. To date, patients that have been followed, antibodies are still showing present as long as 90 days after either symptom onset or infection. With the exception of the United States, most countries around the world are actually using the antibody test to make a diagnosis in symptomatic patients. With regards to having the antibodies, having been exposed before and still producing antibodies that are circulating in the blood, in the plasma or serum, that there is yet to be definitive research all with regards to long-lasting immunity from reinfection. But there have been few, if any, documented reinfections in the United States with this virus. I will tell you that in the healthcare setting, if you are a healthcare worker, a nurse, etc., that has succumbed to COVID-19 and recovered and has circulating antibodies, they usually assign you to the COVID unit in the hospital because of the strong enough belief that you are protected by those circulating antibodies. What we don't know yet scientifically is whether it protects you against mutated virus, of which there are more than 20 mutations of the SARS-CoV-2 virus that have already been identified. But the antibody test is the most rapid of tests. You can get results in about 2 minutes with most of the tests. Those tests that have been approved by the FDA have sensitivities and specificity in the 95% and higher range. So if you have the antibodies, it's very accurate with regards to the fact that you were exposed to the virus and you are producing those antibodies. with regards to how long the antibodies last, my guess is, based on the data that I've seen, probably anywhere from 60 to 120 days. We just haven't been monitoring patients long enough to know how long those antibodies are present and what long-term protections they provide. But it would give our employees at least a sense of whether or not they have antibodies, which makes them less likely to succumb to a reinfection. Thank you, Madam Chair.
Thank you.
Thank you, Dr. Hopes. But what it sounds as if is that what we are embarking on here is a decision whether we want to detect or protect. And detect the presence of the virus as best we can, because literally there is no protection. Everything else here gives us evidence of the existence of the virus being active. So this protects not only people who are symptomatic, but who are asymptomatic. Because if you're symptomatic, you're not going to show up with the antibodies anyway, unless, like Dr. Hope says, 4 or 5 days from after the onset. Okay, I think that's all I want to ask right now, Madam Chair, in terms of going. And this is your recommendation that we do antibody testing.
It is. And remember, if you're seeing your healthcare professional, if you're sick and you have symptoms and they're going to tell you you need to get tested, they're probably going to send you for a PCR test. That's where they're going to send you. Your doctor will send you. They'll tell you, you need to go get a test. You need to be diagnosed to see if you have it. So that's really up for them. We believe that's up for the medical professionals to do that. Let the doctors send their patients to get tested for the PCR. And there's plenty of test sites around, and they don't charge anything. It's the idea, just what Dr. Hopes has stated. The antibody test would allow people to know that they may have had it. I could have had symptoms and I might have had it mildly. Now I have the antibody in my system. Now I know now I know I have it. So it could be beneficial, and that's why you're seeing Lake County, and we're just using them as an example. They were one of the first districts in the state. Lake County pushed out, and they had a drive to have employees get tested, and the test that they chose was the antibody test.
Okay.
Just for that reason, for maybe it's a peace of mind reason.
I don't want to digress here, but can we, from the antibody testing, develop, and I know this is inartful, but I'm going to try to say it, can we develop our own that magic word, that not productivity, but rate.
Prevalence rate?
Yeah, what did you say, Doc?
The prevalence rate.
Yeah, the prevalence rate. Because I think part of what we are dealing with here in this community is a prevalence rate of, depending on who you ask. But I'm really concerned with trying to create a prevalence rate that we can use to help us to determine how effective we are being in terms of protecting the employees and the students. Will the antibody testing help us with that, since it can show whether you've ever had it or not?
Well, remember, so we don't know how long it stays in your system. Like Dr. Hopes, it could stay there 3 months, 4 months, 2 months. So you may have been ill back in February and take the antibody test, and it might not show up that you have the proteins in your system.
But and I want to make sure I'm correct, what I'm seeing here is that if we do the test frequency, tested once, that's $286,000.
So let's talk about the numbers. So we use the employee number we have right now, full-time employee of 5733. And we talked about the cost. The high cost is $50. We know that the range of costs around right now in Florida are low 20s to $50, $60 in that range. So We think obviously our cost would be lower, but we're just quoting the $50 right now. So we're just trying to come up with some estimates. So if every employee wanted this test and they had, COVID-19 exposure, they may have had symptoms in the past, maybe they experienced mild symptoms, but they never went to the doctor. They want to know if they had it. That would be the cost at $50. If it's half that price, and the going rate might be low 20s, it might be half of that. So it might be around $140,000 there instead of the $286. Again, if you wanted to say, well, not every employee is going to take us up on the testing, maybe 50% would, and that's the second option. Just try to estimate. Again, if the real cost is low 20s, not 50, it might be $75,000.
Let me get to the question that I really want to ask. How much of the $1.7 million that we approved earlier for the superintendent to use for COVID-related expenses could be used to create an antibody testing program? And I'll ask the superintendent that. And when I say, let me create a parameter here that works. Dr. Hopes has said that 60 days. So if we're talking 180 days, that's that's 3 tests a year. Does that work out about right? Did I say that right? I'm glad I'm not in school. I'm being a mess. But could we get this done using some of that money to make sure that as many of our employees as desire would want to participate in it? How much would that cost? Are we talking $1 million, $750,000 if we were trying to do reasonable testing? That
Currently, it costs nothing because the federal government is paying for it if you're uninsured. The health plan pays for it if you're insured. We can have all of our uninsured employees and insured employees go to a local lab and get tested the same day. Mr. Wagner and I discussed this. There is a laboratory, a full-service laboratory in the county that bills the federal government directly. So we do not need to budget any money for this for right now. At least through the end of December, the CARES Act is providing 100% of the funding for testing for COVID-19, including antibody tests.
And that's why if you look at option 3, if you look at option 3 on the screen, we're just giving recommendations to the board, continue to educate our workforce and provide information on new government programs. Dr. Hopes had talked about HRSA, which I believe is the Health Resource and Services Administration. But so it may be that now, and today was the first time ever that they offered free antibody testing right here in Manatee County. So that is available free, and like Dr. Hope stated, it is available through those individuals who are participating in our insurance plan, and also the federal government is having other projects and plans coming forward to help people get tested. They know people want to be tested.
So what do you want us to do?
Well, you ask us to provide, a recommendation, and everything's changing so fast. I mean, things are changing fast from the state, from the feds. We have the CARES Act money. If we were to budget money for this out of the CARES Act, that might be one idea. Another idea might be to reevaluate it, bring it back to you, reevaluate, see where we are in 2 weeks, see if there's more free testing sites popping up for the antibody. We're just simply providing you the information because that's what you all had asked.
My last question, and then I'll pass my right to speak. Would it be helpful if we were able to start with a baseline at the beginning of the year to try to create some understanding of where we are as a district, as a group of employees trying to serve these 50,000 students? What stops us? I mean, right now, this is Tuesday. What stops us from including in our preparation to meet the students the opportunity for every employee to take advantage of the antibody antigen test, so that at least on that day, we will know kind of where we stand in terms of whether we're going to be a problem for the kids coming to us or not.
I guess the question is how many people will take advantage of that, because to be honest with you, they have that ability now. It's covered 100% of our health insurance plan.
Okay.
The uninsured are covered by the government. So they're not taking advantage of it right now. We cannot compel people to take the test.
I'm not a gambling person, not big money anyway, but I would bet you most people don't even know what we're talking about here. Most people don't have a clue as to what's available and what is, and how to, most people don't know the difference between an antibody and an OCR test or whatever that other initials that you were using. I guess what I'm really asking is, in conjunction with the Mask Up Manatee effort that we have said that we want to engage in, can we put as much effort into promoting this and providing information to our employees? Because it not only helps them, but it helps those who have children in the system. It helps those who have spouses or significant others or parents that live. It helps in a lot of ways. So I'm just saying, if there's something that we can do to facilitate this or to precipitate this, then we need to do it. We don't need to just be talking about it.
We have messaged to all the employees that it's covered. So we can do that again.
Remember. So here's a suggestion, Madam Chair.
I'll take it. What you got?
Okay. So first and foremost, we've only discovered in the past week and a half that there is a federal program and there are labs in Manatee County who will do the direct billing for our uninsured employees. They will also, because the network has been waived by the insurance company for COVID-19 testing, they can also take our insured patients. My suggestion is that we put out a communication in collaboration with the health department, because still any of these tests still require a physician's order. The health department can actually issue the order. So when you go to one of these testing sites, the health department is actually issuing the physician order for that test. So as Reverend Golden has suggested, as an augmentation to Mask Up Manatee, my suggestion is, knowing what we know today, that it is covered both through the health plan and through the federal government for the uninsured, that we send out correspondence to our employees. We make it easy for them. We can talk with some of these local providers about making it easy, along with the health department, so that they can go and get tested. These results will come back within 24 hours. The one local lab that has all the licensure and authorization will give us same-day results. So my suggestion is, as part of our campaign, because I, both as a board member and as an epidemiologist, I would like to know the status of COVID exposure in our school district. I think it will benefit us as we move forward, and I think it will allay some of the fears and concerns, and we can then move into an ongoing monitoring program and funding it should the federal government stop funding of it. Right now, while they have funding, what we don't want to do is we don't want to create funding, because then they would no longer be uninsured. And so my suggestion is that we work with staff and the health department under Mask Up Manatee to have a campaign to encourage our employees to get tested and get the antibody test, which is the most cost effective. And quite frankly, it's the most accurate, because, you know, a PCR test is going to do you no good 3 months after you've had the virus, because chances are the RNA is not going to be present. So this is the right test for what we're trying to accomplish.
Doctor, let me ask you a question though. If we do this, you're an epidemiologist. We've just gotten a full-time epidemiologist here, courtesy of the health department. Can that person write? Can they write prescriptions? Are they eligible?
No. The epidemiologist from the health department is not not a,
Okay. But we can do this in conjunction with the health department and get it.
we can do it. One of the things what I was going to bring up, as part of this conversation, had I been there, is that consideration by the board to contract with an employee health physician during this pandemic. Having the epidemiologist on staff, being provided by the health department is an incredible plus for us.
Yes.
Because that way we will have an epidemiologist helping to make the decisions about how long someone needs to be quarantined, et cetera. With regards to the testing, I'm confident that we can get the health department to collaborate with us. And I'm happy to talk with the medical society about the potential of contracting with an employee health physician so that anytime an employee needs an order for a test, that can be readily available to them almost immediately. But I think we can get through the prescription issue. Obviously, we want our employees who are covered under the health plan who have family physicians. They should consult with their family physician about their concerns and their desire to be tested. It's a telemedicine visit, and it's easy, and there's no copay for the testing. So I think you're right, Reverend Gold. We need to communicate this clearly and succinctly to our employees and provide them with the opportunities and how to easily access the testing. And that's the key. We've learned a lot in the past week and a half. And I think now, I think what the board should do is provide direction to the superintendent to include antibody testing in our Mask Up Manatee efforts and do that as soon as possible. My original desire was to have this in place 2 weeks before school started so that we could get a majority of our employees tested, but we can still be ahead of the game. Thank you, Madam Chair.
Madam Chair, I will second that motion. Yeah.
All right. And to be clear, Dr. Hopes, your motion is to include Mask Up Manatee, the antibody test as part of a push in Mask Up Manatee. Am I understanding that correctly?
For school district employees, yes, Madam Chair.
Or school district employees.
Specifically to address the issue of protecting the students as well as the employees. That's what this is about.
And
that's what people keep, all of the emails that we're getting, people are afraid. They're just afraid. And every one of them has an opinion about, based in fact, from Wyoming to Hawaii to New York, everywhere. And so this is a thing that we are doing that is designed to allow.
Proactively.
Yeah, proactive to do that. So I second that motion.
Okay. Is there any further discussion on this? Mr. Minor?
Okay, I think that making clear the benefit of why we do the test is so important to our employees. Why have this test? And I think, my understanding is that, and why I had a test, I don't know, about 6 weeks ago or something, was to see, if I had, this in my body. It came back negative after, I don't know, about 2 weeks. It was kind of slow. And so that if I had it, I wanted to quarantine myself so I didn't pass it on to someone else, or at least, and also take steps to try to minimize the how the symptoms affected me personally. And but I think that with these antibodies, the idea is they would reveal whether the person has this virus. I think that's number one, and two, to be able to maybe find out others who have the virus, to quarantine that person and persons from having it spread even more. To get our arms around how much it affects the community. And I don't know how much we or even outside of the district, we have emphasized the the benefits and why you need to get tested, and that's why I think so many people are not tested. And I think, you know, I heard something like, you know, in the White House, the president gets tested daily or several times a day to, you know, kind of stay informed about, and the president should be. You know, we don't, however you feel politically, we do not want a president, you know, who is, you know, going through this. And if he did have it, we would certainly want as quick response as possible to his condition. And that's the same thing with our employees. You know, we're not going to test them every day, but we want people to get that test and to be dealt with appropriately. Now, if you have the antigens, you know, in your body, I guess that means you're sort of cured, isn't it? What does that mean? If any one of us, you know, were to get tested and it comes back and says, yeah, you know, you've had it before or you're suffering from it before, what does that say? What do we tell a person who comes back, you know, positive, and they say they're, well, maybe it was a year ago. What do we tell them? Just because it comes back positive, you know, do we say, you know, you got to stay at home and away from everybody, or, you know, you are a source of cure, you know, for other people who may, you know, possibly become sensitive? What do we do? I'd like to hear that from
The
you all.
antibody test actually doesn't show an active infection. It shows the fact that you had it before and you've recovered from it. And so for the district to promote this and pay for this and take care of this is actually a very selfless act on the part of the district, because for us there's no benefit. We're not identifying the people who are actively sick. We're trying to give people the peace of mind of knowing I've had it, I've got some protection. That's what it's for.
Okay, so the antigen test, which shows,
Antibody test, not antigen. Two different.
yeah, what am I don't know. Antibodies. Where did I get antigen in?
That's another test.
That's another test.
That is for active
Okay.
though.
The antibody test, if it detected antibodies, it would show that, it would indicate that that person at some point, you know, had this virus, but is cured from it. Does that mean that that
Recovered
person?
from it, correct.
I'm sorry, what?
Recovered from it.
Recovered,
Now, if an
okay.
individual tests positive for antibodies and is symptomatic, that indicates that they're in an active disease state. If they test positive for the antibodies and they're asymptomatic, it's an indicator that they have recovered from the infection, that they would be most likely not able to transmit be contagious, because the antibodies tend to neutralize the virus. And in addition to that, it indicates that there is some level of immunity to that virus which they contracted and the strain of that virus. And if they have tested positive for antibodies, they're a candidate to donate convalescent plasma so that someone who is ill in the hospital can receive that plasma as a treatment and a cure.
Well, I think, you know, Dr. Hopes, is explaining why, you know, another benefit, and you know, for the testing, and I think that needs to be, you know, communicated to the community and certainly, you know, to our employees. This is really good for every individual and good for the district, and we want to get it done, you know, the sooner the better, and it's going to be free. So please do it for your own health, your family, and for the people you work with.
And one of the biggest factors in this, as I'm thinking through it, is that with this broad testing, we will have identified a pool of individuals within the school district. Should we experience a surge in hospitalizations again, we will have identified a number, probably hundreds of individuals within the school district who are potential donors of convalescent plasma, which they have discovered is one of the best treatments for those patients who are critically ill and in the hospital.
Yeah, so we get on with it. Thank you.
Thank you, Mr. Minor.
Reverend Golden?
Madam Chair, call the question.
Thank you. I guess we'll vote on that. All those in favor of calling the question, please signify by saying aye.
Aye.
Aye. Any opposed? I guess you didn't need to call the question. So, to be clear, the motion on the table is to incorporate the antibody testing as part of the Mascot Manatee program, for lack of a better word. It has had a motion and a second. All those in favor, please signify by saying aye. Aye. Any opposed? Great, that passes unanimously. Thank you so much for all your time and all your hard work.
We appreciate the opportunity. Thank you.
Okay, the next few items are board items. The next one is about approval to post the position for internal auditor. Do I have a motion for that?
So moved, Madam Chair.
Okay, I've got a motion and a second. Is there any discussion on this? Okay, I feel like we've discussed
Ask
this.
for your support.
Yep, I feel like we've discussed this already multiple times. Hearing no further discussion, all those in favor, please signify by saying aye.
Aye.
Aye. Any opposed? That passes unanimously. Moving forward, approval of reappointment of members of the Citizens Financial Oversight Committee. I'm looking for a motion.
So moved, Madam Chair.
Second.
Got a motion and a second of the approval of the reappointment of members of the Citizens Financial Oversight Committee. Is there any discussion?
Madam Chair, or do we not have to accept the 2 resignations, just the reappointment?
That's next.
I think that's on here. I think that's the
Oh, I'm
next
sorry.
one.
It's the next item, my bad.
Yeah.
Call the question, Madam Chair.
Then I have to take the vote on calling the question. All those in favor of calling the question, please signify by saying aye. Aye. Any opposed? The motion to call the question has passed. Let's move. Now we will actually vote. Approval of reappointment of members of the Citizens Financial Oversight Committee. All those in favor, please signify by saying aye.
Aye.
Aye. Any opposed? That passes unanimously. Thank you all for your help and your willingness to re-up as you walk in. Thank you.
David Ballard, Susan Harrington, and Bobby Stinnett.
Yeah, and Mr. Ballard is here. He graced us with his presence. Oh, no, it's okay. You're free and clear. Okay. Next item, acceptance of the resignations of the Citizens Financial Oversight Committee members. I'm looking for a motion.
So moved.
Second.
Okay, I've had a motion and a second. Is there any discussion? Vice Chair Kennedy.
Just want to take a second to thank both of these founding members of the committee. Mr. Christopher was our first chair of the Financial Oversight Committee, and he did a very difficult job with a lot of grace and talent. And Steve Servant also, I've really, it hasn't been much, but my experience with Steve, guy's a consummate professional, and even in some hard debates, and this committee will miss both of them greatly, and I thank them for their service.
Thank you, Mr. Kenny.
Thank you very much. Hearing no further discussion, I'll call to vote. All those in favor, please signify by saying aye.
Aye.
Aye. Any opposed? That passes unanimously. Approval of the appointment of Miss Cindy Spray to the Citizens Financial Oversight Committee.
So moved.
So moved.
Madam Chair?
Yeah.
I'm sorry, has that been seconded?
Yes, there was a motion and a second.
Madam Chair, I'm going to,
And there she is.
I moved first, so.
I'm going to move to table the appointment of Mrs. Spray to the Citizens Financial Advisory Committee. I think that we need to explore the opportunity of creating more diversity and more inclusion on that committee. So I'm going to move to table this particular appointment. I understand that there are 2 vacancies now that exist, and I would like to explore the opportunity of trying to find minority participation. And I must have a recess if we're going to discuss this.
Okay, Reverend Golden is asking for a recess. Is there any opposition to that?
There has to be a second to his motion to table.
Yes. Is there a second to table his motion? Or to motion, yes, there, yeah. Did I say that correctly? It's getting really late, sorry. Is there a second to table the current motion? Hearing none. Let's move forward to public comment. I believe Mrs. Spray submitted a public comment. Would you like to come forward? I know you signed up. Do you want to come forward?
I don't know what the protocol is. I'll just leave my mask on.
Yes.
I am Cindy Spray. I've applied up to be on this committee since its inception. It was a crowded field, and I've been patiently waiting and watching and going to the meetings. I'd be honored to serve on this committee. I think I bring a lot of different talents to the committee, and I would just accept your vote. Appreciate your vote. That's all.
Thank you.
Thank you.
Madam Chair?
Dr. Hopes.
Yeah, if there's no other public comment, I'd like to add that Ms. Spray was recommended by the full Citizens Financial Advisory Committee to fill one of those vacancies.
Thank you. Vice Chair Kennedy.
Thanks, Madam Chair. I agree with Reverend Golden in that across this district, we need to increase minority representation. But as has been said, Ms. Spray has been waiting for a long, long time, and she's been very persistent in her interest in this committee. And I appreciate your patience, and we've finally gotten here. So I'm happy to approve you. So thanks.
All right. Hearing no further discussion, I guess I'll call it. He's not here, but I'll call it. All those in favor of the approval of Ms. Cindy Spray to the Citizens Financial Advisory Committee, please signify by saying aye.
Aye.
Aye. Any opposed? Okay, that passes unanimously, 4-0. Congratulations. What you've signed up for. And with that, we are on to public comment. So I'm going to hand it over to Vice Chair Kennedy.
Since this is our first time back with public comment in the room in months, I am just going to really quickly go through our protocols for public comment. It's not an open forum to discuss matters unrelated to education, to support or oppose candidates for public office, or to engage in commercial speech attempting to sell a service or product to the board or public. Thank you, Mr. Chapman. Also, public comment is not a forum to attack individual school system employees. Any such complaints should be submitted in writing to the superintendent for appropriate handling. Finally, this is not a forum for addressing issues involving individual students. Those should also be directed to the superintendent for appropriate handling. Each speaker is allowed 3 minutes. The rest of that is good. And if you have a handout, anything you'd like to include in the minutes or for the board members, if you could give those to the agency clerk. I think we are ready to go. I'm a little out of practice with this, but Mr. Jamisco, you are first up. And Sarah B., you are next. I'm not sure if Sarah's outside or... So where are you? Oh, there she is back there. Okay. Senator, the floor is yours.
Thank you. Good evening, and thank you for the opportunity to speak to you today. My name is Tommy Jamisco, and I'm the Choral Director at Manatee High School. I've been a Manatee County resident for 40 years, and I'm a product of Manatee County Schools. I graduated from Southeast High School, and this is my 20th year teaching here in the county. I'm the immediate past president of the Florida Vocal Association and serve on the executive board for that organization. I've also served on the board of Florida Music Educators Association. More importantly, I'm a parent of 3 awesome children. They are all Manatee County students, and a husband to a kindergarten teacher at Freedom Elementary. Needless to say, we are fully invested in this community and our education system. We've been here through all the ups and downs. I'm here to discuss the issues we're facing with the performing arts in our secondary schools. I could bring up statistics that have repeatedly been confirmed through numerous studies that show the positive effects of students being involved in finding performing arts, but I think that many of you sitting here, including Mrs. Saunders, are already aware of the academic virtues of a quality arts education and their contribution to a student's development. We also give students a place to be themselves. We explore the artistic side of their personalities and emotional investment and release where they can utilize another part of their brains. This is what we need right now. Our students are returning on Monday and excited to return to our classrooms. Our classes are significant in their development and their mental health. Unfortunately, we're headed towards the opening of school next week, and in 5 of our county's high schools, 0% of the students in the performing arts classes are in the classes they registered for. 0. In order to accommodate the amendment to the MOU that was presented to principals on Friday, July 31st, administrators have been scrambling to rebuild the entire master schedule at all of our high schools to ensure that we don't spend too much money paying teachers the $3,000 or $6,000 supplements. The end result at almost every school is a watered-down schedule that put all music students in a generic music theory or world music class to make sure each teacher only has one modality. This is not a COVID-related problem, this is a Manatee County problem. No other school districts in the state of Florida are doing what we're doing to these music programs. This is not due to distancing or sharing instruments as was put out today. We have spent all summer learning how and trained to safely teach our subject matter without risking our students' health, using data from major studies. The MOU, teaching one modality, and the supplement for those modalities are all good things, but when put together, giving two administrators 2 weeks to build a master schedule, you end up where we are right now. This means we have no band, no choir, no orchestra, no theater, and in most cases, they're not even with the teacher that's most qualified to develop them in the desired art form. For instance, I'm assigned as the hybrid teacher, and my son, who's been registered as a 5-day brick and mortar student, that means he's no longer in my course, and he is in the orchestra teacher's music theory class, maybe twice because he was also supposed to be the drummer in jazz band. The effects of this series of events will be long-lasting. It takes a superior teacher 4 years to develop a program. 1 year without that consistency of high-level teaching, and you'll essentially have to start over. In addition, all middle schools this year are reduced to 2 music directors, creating combined positions or eliminating programs at all of our middle schools, leaving my daughter, who's supposed to be in the top audition choral ensemble at Hale Middle School in PE this year, and King Middle School without a choral department at all. I'm not sure how much you know about music education. Can I finish my 1 paragraph, or am I absolutely done?
How about this sentence?
Sorry?
How about this next sentence?
I'm not sure how much you know about music education, but teachers that can teach more than one area are very rare, so the combined programs just don't work. Thank you very much.
Sarah? And Deanna, after Sarah, Deanna Howell. Deanna is outside, maybe?
I'd like to offer my sincerest gratitude for allowing me to discuss my concerns. I think transparency is going to be the only thing to pull us through this pandemic, and I appreciate your time. My name is Sarah Bezek, and I'm the English Language Arts Instructional Leader at Southeast High School. In addition to my various roles within the district, I'm also a product of our district ever since I was 5. From Able to Harley to Bayshore to SCF to USF, I now hold my master's degree in secondary English education, and I have always taken pride in my roots and in giving back to the community that, that enabled my success. I volunteered to teach all 3 learning modalities this year because I'm eager to safely return to my classroom in a sense of normalcy. But to be quite frank, this is the first time I've ever considered leaving our district to serve a different community. Since our closures in March, I have closely followed the medical research, the silencing of health departments across our state, CDC recommendations, and the positions of each of our local school board members. I have watched integrity and morality crumble as we encourage brick and mortar schools to reopen so early into August before our community's rate of infection stabilizes, and before we even know what our plans to reopen entail for those charged with the execution of our imposed plans. Our reopening plans have consistently challenged my respect for our educational bureaucracy at the state level, and they've challenged my faith in you as our board to do what's best interest of our students and staff, and to provide transparency for our community stakeholders. We're scrambling with ways to meet the needs through a pandemic without adequate training, resources, support, or time. We're still discussing the verbiage of face coverings when we have not yet even purchased, installed, or discussed the maintenance of HEPA filters for the antiquated AC systems on our campuses. We have purchased desk shields without any proven safety advantage when used in conjunction with masks, but we have not yet published a clear, definitive set of guidelines or procedures delineating the threshold of infection that would constitute a campus-wide closure, or even what might constitute a smaller scale individualized quarantine, or how any of it will look in practice. We have mandated that our back-to-school professional development offerings not exceed 10 teachers, yet we are seeing class sizes that far exceed that same limit. Our district has confidently offered the option of e-learning to our community without adequately updating our digital learning platforms to sustain it, and without having trained our staff to effectively utilize it. The only PPE I have currently been provided as of today is a 1-gallon jug of hand sanitizer. Aside from those legitimate safety and academic concerns, I have several concerns about the MOU. The stipend promised to teachers in the memorandum provided the illusion of teacher choice and the illusion of compensation being offered to teachers willing to teach all three modalities. In reality, the funds our district put into satisfying the stipend were entirely inadequate in actually offering any teacher an informed choice. Consequently, some of our teachers were forced to choose between forgoing their stipend or losing the classes and students that they've grown to love. Administrators were forced to rework all master schedules at the very last minute, often having no choice but to cancel certain electives entirely, despite several teachers being willing to forgo their stipend. We still lost those electives. Please reconsider your reopening plans. HEPA filters, please.
Thank you.
Thank you.
Dina? Dina, are you here somewhere? Dina, are you outside? I'm going to skip past Ms. Howell. Kendall Carrier, and then after Mr. Carrier is Bridget Mendel.
Good evening. My name is Kendall Carrier, and I am currently the Director of Music at Parrish Community High School. I've been a music educator for over 30 years, and I appreciate the opportunity to address you all tonight. The Manatee County School District has achieved a high level of excellence in academics, athletics, and the fine arts, just to name a few. We have much to be proud of, and I hope in the future we can look back on all that we have done during the pandemic with the same level of pride. As a music educator, I feel zero pride in our current course of action. There is no script for a pandemic, and I understand that you all have a very difficult job, but that doesn't mean mistakes or missteps have not or will not be made. In music and athletics, when mistakes are made, we call them out. We assess the problem, we make corrections, and we move on to achieve a higher level of excellence. I hope the school board will do the same. I believe we need to be honest about cutting electives. It will not be a temporary solution as stated on the news last night or in a memo this morning. Cutting band, orchestra, and choir classes now will set our fine arts programs back for years to come. I have seen similar situations like this play out before. It never seems to end well. Was it the plan all along to cut music programs and proceed with general music for all music students? Is that why some of our music educators became non-essential last spring? If general music was the plan, why wasn't this communicated prior to August 3rd? Today at school, I was watching a video on a pre-K mobile learning lab. It was a really cool idea. In the video, our superintendent states that whenever we see obstacles, it feels great to go the distance to fulfill a need. I agree 100%. There have been many obstacles since last spring, and I do not believe we've gone the distance for the music students of Manatee County. We have instead imploded music education countywide. Just last night, a school official stated that playing music is simply not safe since students share instruments. My program does not share instruments, and many music teachers have been working hard all summer to acquire extra instruments through donations, all right, so students will not have to share. Are these efforts now null and void? Many teachers were told in a plethora of meetings that our ability to play and sing in music classes would be a site-based decision as long as we could adhere to CDC and School District of Manatee County guidelines. Is this true? Some schools get to play. I don't. There is no equity here. Administrators have stated that the three modalities have made the scheduling of electives nearly impossible, and they were instructed to focus on core classes and graduation credits first, even if they had to eliminate electives. Is this true? It's exactly what happened at Parrish Community High School. While there is great integrity in open and honest debate, transparency, if you will, I believe there is zero integrity in political pandering, passing the buck, half-truths, and talking points.
Thank you.
Thank you for your time.
Bridget Mendel? Mrs. Mendel, are you here or outside? Michelle, do we know if anybody's outside? Okay, great, thank you. Leland Theriot?
Hi.
Hi.
My name is Leland Terrio, and I'm the Executive Director of the Florida Alliance for Arts Education. And I live close by, and I saw a thing with Scott Hopes last night, and I thought I might come here and bring you presents. So in these difficult times, we have all had to pivot our daily plans. I am sure that what I heard last night is just a very simple error in understanding. No one could possibly believe that deleting the option for our students to take performing arts classes is in their best interest. Not only are they missing an academic need, but a social emotional one as well. Let's face it, studying music theory, while I personally think it's very important, it does not address that need. Nothing, and I heard this in the thing, nothing that I know is too difficult for teachers. I think there's been an error because in the last few weeks of summer, not the last few weeks, almost the whole summer since June, all the music supervisors, all the visual arts supervisors have been getting together weekly. The music supervisors 2 times a week. And you guys don't know about this because you don't come on those meetings with us because it's not your thing. But the result of those meetings have been that they have come to some conclusions about some of the best practices for having performing arts classes, not only for music, but also for theater and also for dance. And you just don't know what those are because we haven't told you them yet. Because we didn't know the results of the last study until last Thursday afternoon at 4 o'clock. And your art supervisor here for this county had Friday as a personal day. So on the same day, Monday, that Dr. Scott Hopes was saying what he said on the news, Julie Hebert had not had an opportunity to share with you the results of that study yet. I have emailed each and every one of you. I don't think I sent it to you, so I'll send it to you. The link that shows the results. It's so recent, they haven't even finished the 1-pager for it yet. And I'll send that to you when it comes. In the meantime, I brought you the National Arts Education is Essential document. It is a national document. These are all the endorsing organizations at the national level. We've also endorsed that on the state level. I'm also giving you this nice pretty binder that is called Back to the Arts. It's been put out by Orange County Schools, and it is 66 pages of a comprehensive plan for all of the performing arts and visual arts, kindergarten through 12th grade. It was done with a great deal of research and a great deal of different studies. And other people's plans, and I really hope that you will enjoy reading it. Thank you.
Mrs. Terrio, if you could leave those with Bashir.
I will.
Thanks very much.
There is one for each of the board members and one for the superintendent.
Thank you.
You're welcome.
Chris Peters, you're up next, Mr. Peters. And then Elise M. is up next after Chris.
Good evening. I'm here to address the same issue that both Mr. Jamisco and Mr. Kendall have already addressed, except I'm coming into it not from a music standpoint, but from the vocational side. The unintended consequences that have been imposed on those of us in the classroom by the decisions you guys have made is completely decimating our elective programs. Our kids are being put into a single generic class across the board, not just in music, in vocational, in medical, in arts. All of those programs have been completely had their legs cut out from underneath them. This is the second time I've come to this board to address things related to those specific things. And I find it ironic that behind you guys are pictures of singing, music, arts, and vocational. And those are the programs right now that you've just taken the feet out from underneath. I have a son who right now will probably not qualify for his Bright Future Scholarship because he's not going to earn 3 full credits in his CTE course codes because he's being put into a generic course at the beginning of this year. My students that have worked through levels 1, 2, 3, and going into level 4 are no longer going to get their honors bump for taking an advanced class. So your unintended consequences have just cost those kids GPAs that on scholarships and on college applications may set them back. And as Mr. Jamisco said, we're the only county that we know of that is doing this to our elective programs. The sheer frustration that we feel as teachers is just absolutely overwhelming. We're losing our industry certification funds, hundreds of thousands of dollars per year per school that are up and gone because we weren't able to test at the end of last school year, and by putting kids into a generic program this year, we're not going to be able to cover the material needed to test those kids at the end of this school year. And I'm pretty sure you guys aren't going to give us back the money that we lose out on because of failed industry certifications. You're jeopardizing bright futures. I'm just making sure I covered all my points here. Yes, like I said, I'm coming to it because it is not just music. Music got the headlines yesterday, but it is electives across the board. And it is going to cripple our programs. I have to teach kids my freshman year so that they choose to come back to my program second, third, and fourth level. Not having those kids 1 year decimates my program.
Elise? And Chuck Evans, you will be after Elise. Elise, when you come up, could you pronounce your last name?
Oh, Mirikatani. It's Japanese. It's really a bit different.
Rather hear from you than me.
Okay, I first wanted to say thank you for allowing me to speak today. Music, defined as the written or printed signs representing vocal or instrumental sound. This is an official definition. However, to the students of Lakewood Ranch High School, Manatee County, it means so much more to us. My name is Elise Mirikatani, and I'm the president of the chorus program at Lakewood Ranch High School. And for us, the chorus room is not just a room. It's a place of safety. It's a place where we feel like we belong. Regardless of diverse family situations at home, many fine arts classes become a tightly knit group. For some students, chorus is the reason that they even go to school in general. The love and support of the chorus program is something unmatched. Miss P, my chorus teacher, has proven time and time again that her goal is to not only be a teacher, but to be a supporting figure in your life that wants you to achieve your best. This year, splitting up the classes will not bring a sense of unity on a musical level as well as a personal level. I will now read some testimonies from students at the fine arts programs at LRHS. Here's the first one. We understand that Manatee County is not cutting music programs, but to make sure we understand correctly, students are being combined into music appreciation classes. This means chorus, band, orchestra, and theater kids are going to be in the same class receiving broad instruction not specific to their needs. For example, this student says that I'm an a cappella. I auditioned for this class and I'm getting thrown into a random music class. I will not be taught the advanced techniques which I signed up for. They said I'm going to be in a class with students with different talents and different commitments, and I'm not going to be with the teacher who I've grown to have a deep personal connection with. Last night, as you know, fine arts students at Lakewood Ranch High School created a petition stating our concerns, and within 8 hours there were over 1,300 signatures and comments from community members stating their concerns. Students who want to pursue music as a career will not have the opportunity that they would to progress and succeed in their respected talent. For example, there are multiple students in chorus who plan to major or minor in music. Without direction from Miss P, they will not have the advantage to thrive in their future careers. Finally, this is a testimony from a senior. For 11 years of my life, I was in a sport that was so mentally draining. There would be days where I would wake up and all I could think about was going to practice in the afternoon. However, every time I walked in the chorus room, a weight was lifted off my shoulders. When I am performing on stage or even just in class, I look around and feel an overwhelming happiness. It is an emotion that I never felt with the sport. So, today I'm speaking on behalf of other students who are concerned about the future of their programs. We understand there's a lot of uncertainty and many changes are being made on a daily basis in order to protect our safety. But we wanted the chance to address our concerns and how important the fine arts are to us. Thank you.
Very much. Okay, Mr. Evans.
Thank you.
Stacy Bartik, you're going to be up next.
Madam Chair, Superintendent Saunders, and Manatee County School Board members, thank you very much. My name's Chuck Evans, and I come to you tonight to speak on some very concerning instrumental music class concerns. I come to you as a teacher of AP Physics and Calculus at Riverview High School in Sarasota County. For the last 22 years, I've been teaching my students to analyze situations, very difficult situations, and how to come up with productive solutions to them. been doing that very successfully, I think. I come to you as the Associate Band Director of the Riverview High School Kilty Band, so I have some knowledge of music and the impact that it has on our students. I come to you as a master scheduler, 17 years of experience at Riverview High School, and I can tell you that this would not stand down in Sarasota County, and it should not stand here. I come to you as a husband of a district band director, and I have a lot of insight on some of the things that have been happening with the schedules, not only at her school, but all of the rest of the schools with my colleagues who are area band directors. And most importantly, I come to you as a father of a rising 6th grader at King Middle School and a 10th grader at Manatee High School. She's absolutely devastated. Superintendent Saunders sent out an email earlier today, because I had emailed all of you and she replied. She was very generous to do that. That band and fine arts have been cut, or excuse me, have not been cut. And there was a circulating statement from the county, from the communications office, that says, at the same time the district was preparing for the school board meeting, rumors were circulating on social media and in the community that the district was cutting or eliminating school music and arts programs. These rumors are absolutely untrue. I'm going to tell you right now that, in my opinion, that is completely disingenuous. Okay? School are losing the programs. They're losing their band programs, their chorus programs, their orchestra programs, and it should be unacceptable to you as school board members, to the superintendent, to the district officials. That should be absolutely unfathomable that it's happening. The reason this is happening is because of the 3 modalities. I realize there are unintended consequences, and as a master scheduler, I would hope that all of the other district officials that would have seen this would have known immediately that it is not possible to run a program with 3 different modalities and do it fairly to all the teachers and be able to keep the electives. It's just not possible. And I've been doing this for 17 years. I can tell you that at the beginning of this meeting tonight, Jeremiah Bowman said we must have instrumental music. It's time for you to rise up.
Casey Bartik, please, and Ms. Howe, I'll come to you. I called Ms. Bartik first, so if she's here, I'll let her go. She did. Thank you. Thank you. Ms. Howe, you're up.
Hello, I'm Dina Howell. I am the ASME Labor Union Local 1584 President. Currently, I represent about 1,071 support staff employees in the school district. I support bus drivers, aides attendants, custodial, food service workers, mechanical, maintenance trades, and warehouse workers. This summer, because of course, COVID-19, I had a lot of employees that worked outside of their normal. They supported the district. For example, my bus drivers, they drove and sat out for 8 hours, providing web internet access to students that could not. We had aides and attendants that went out and worked in the schools, custodial workers. We had warehouse drivers that drove warehouse buses to help provide lunches for children, the weekend lunches. So this summer, our support staff, I think, really supported the school district. They went out of their way, they were out of their comfort zone, but they supported the district. And I'm asking that the district support the support staff by postponing the beginning of school, giving us a later start date. I have so many people with underlying health issues. I have people that are taking care of mothers, fathers, older husbands, children with underlying health issues. So I do ask the board to consider a later start date for the school. Thank you.
Thank you, Ms. Helm. Stacy left. Riding Jones. Riding Jones is up now, and after Mr. Jones will be Bryce Wilhelm.
Rodney Jones, greetings, and glad to see so many people here supporting the dysfunction here. I heard Reverend Golden say a lot of people didn't know even what we were talking about up here. It sounded like we didn't know what we were talking about up here, and that's a concerning part. I heard people talk about racial bias and all these different things, and all these, my friends out here, my new friends out here that are disputing some of these decisions. You guys are playing with people's lives here. And I don't think any of you have a competency level to do so, and that's the concern. We're in the middle of a pandemic and a virus, and we haven't even handled things that happened before this came along. And I'm here again on behalf of some of the things that happened at Lincoln Memorial Academy. We're not going anywhere. I'd like to give you an update that Cynthia Saunders is going to be in a whole bunch of trouble here in a second because Shirley Gruber can't respond to those deposition questions and has refused to after 45 days. Then the attorney asked for another 10 days, and she still hasn't responded, so now she's coming up on being compelled by the courts, and they usually do that with jail time. And unfortunately, that document that Mayor Gruber created got passed over to Cynthia Saunders, an illegal or fraudulent document that got used in this board in a legal proceeding, and now has been passed on to a door judge, Bob Cohen, in a legal document presented to a judge in this school district. So when you guys say disingenuous, it's not disingenuous, it's lies. We've got Charlie Kennedy that has gone on the record in an email to me saying that the school district deliberately and intentionally puts out false information to deceive the people. That's an elected official. Now, you can correct it, but the spirit is there. Now, maybe I didn't quote you directly appropriate, but the spirit is there, so don't nut up and back up on us now. Because we've had enough of that already.
You admitted it, that's fine.
Yeah, but not exactly said, but that was the spirit of it. So don't back up now, Charlie. Don't back up now. Don't back up now. We've had enough backing up, and we're tired of backing up. So you guys are up here talking about a lot of stuff that are very important now, but you've got underlying issues here that are going to decapitate your school district here because your superintendent's in trouble. And several of you have gone, including Reverend Golden, have intentionally gone to the community and lied. Lied to a church full of pastors that are now coming back after you and asking for the truth, and you're running from the truth. So it's not just the cutting your electives, it's just a disingenuous school district that has a lot of problems. Dave Minor, a friend to the black community, when we came to ask him for help, the watchdog didn't watch anything. You know, so you guys are a sick bunch of people here, and God's going to have his way with this group, and especially you, Reverend Golden, representing yourself as a pastor. You ought to be ashamed of yourself, God. God's going to have his way with you, sir, and we're going to help him. Y'all have a wonderful evening. And next time, don't have people wait outside for 2 hours. Get a larger venue and respect the people that are down here that have children at home and are down here till 11 o'clock waiting. When you can get a larger venue and get people, instead of, I had to sit outside for almost 3 hours to get in here. It's shameful. You guys are pitiful.
Mr. Wilhelm, Bryce Wilhelm. Oh, I'm sorry, Bryce. Miss Wilhelm. And then Sheila Ballesteros is up next. Sorry about that, Bryce.
Thank you. I have a little bit of a different topic, and I was trying to understand how all this would work anyways, because I've never even been here before. So, as I've gone on the school district website, just searching simply for where I'm supposed to find my child's, the school list, you know, and everything. It's just I was playing around with the new website or whatnot, or the app to go in there and everything, and I came across something written by Miss Saunders over here. It is a letter, and that it's out to from the Manatee County School Board and the district. So I don't know if I'm allowed to ask questions, but I have a very serious problem because my child has law enforcement as their family, and I feel like this letter is a attack, and it's a way to, not a way to start off school, where we're only gonna just bring in more racism with racism. I am appalled that this would be allowed on your website, and if you're not familiar with this, then you need to look at what has been put out and read about this, because this all stems from a man that got killed. And not that I think that it's right that it happened, but it has been brought out now, his body cam, to show the footage of this situation did not go as it has been politically and just taken throughout the country, and all the stuff that has gone on about it. And this is what we're coming out here in Manatee County, Florida, in Bradenton, my home, my entire life, just as most of these other people that have lived here, they've gone to school here, they come back here, and you raise your children here. Now I have children here, and they're in Manatee County schools. And this that I've read on here, and I am just appalled. And I am not the only one, and I am not going to stand for it. I want to know if this is some kind of rhetoric that you're going to be teaching, and as it says that you're going to be, she's going committed to using all of the resources to fight the systemic oppression and implicit bias. Okay, I want my child to be fully rounded and cultured, and as I grew up, but not forcing some kind of systemic racism baloney that does not exist here and does not exist in my home, and I don't want some kind of false pretense given to my child in their school. So with that, I will close.
Thanks very much. Sheila Ballesteros? Okay, I guess Sheila's not here. All right, Madam Chair, that concludes public comment.
Thank you. I know it's not typical that we respond to public comment, but since they were all very similar, and this is something that you have responded to and something that Mr. Barber had responded to, is there something that you can help at least me understand? Because I think what I'm hearing is different than what I was told earlier, and I'd really like to best understand scheduling. I'd like to understand course codes. I'd like to understand a little bit more about what was said so that either I'm better informed or everyone else is better informed, because I'm hearing several different things and I really want to know that I'm getting an honest answer.
Absolutely. I appreciate the opportunity. I am able to look in every school's master schedule. And as was stated earlier today, Braden River High School has the courses scheduled as such. Some of our other high schools do as well. I think the task has been very challenging. Each school determines what offerings they're going to have. They work on their own master schedule. I think some determined, and this is what I heard from an explanation today, not from Manatee. I didn't make it to Manatee, but I did go to Lakewood Ranch High School. What I was told is they placed a general term and they were separating that out in modalities and ability groups after they got everybody scheduled. I didn't go to Manatee, but don't worry, I will be there tomorrow. So I do think that it has been very challenging for many, and some are more adapt to making the adjustments and changes. Again, I'm looking at Braden River High School's master schedule right now, and they didn't list everything with just one general topic. Not saying you can't do it that way. There are many ways to do a master schedule. I was a high school principal. I've done master schedules many a time myself. I've had Art 1, 2, and 3 possibly in a class, or sections Generally, you put your beginning ones together and your advanced together if you have to mix. I've not called everything one general course. Again, I'm not saying that you can't do it that way. I'm not sure how that was determined to do it that way, but that is how some have chosen to do it. I do believe that today some of it has been worked out and some of these issues were corrected at Lakewood Ranch High School. My goal tomorrow is to go and see how myself and other staff can help make some improvements at Manatee, not for just band or music, although I had not heard any concerns for the other electives, but I'm looking at all of them now, so that we can ensure, and again, it should be generated by course request. If there are lots of students requesting a course, there's no reason for it not to make. I did discuss with Mr. Sauer, who handles all of our other virtual programs, that if, for instance, we have a section called AP Physics, for instance, and by splitting it in 3 modalities, generally you only have 20 kids in a school that are going to pick an AP Physics or AP Macroeconomics, something like that. Splitting it, you may not be able to create a section of 5. That could be all that you have as an e-learner. However, Mr. Sauer can hire a district person to pick up that one e-learning section and capture all the pieces of 5 so that section is able to make. So we do have some flexibility, some ways to work with his department and so forth. There's no doubt they've all had a very short time period to make it happen. And again, I think it's a difficult task, no doubt. As the gentleman mentioned in the back, doing a high school master schedule is a very challenging thing, but it is driven by the request of the students and teacher certification. So I do know that many things have happened, but we will definitely go and try to assist. I think I've heard concerns at Parish, but I've looked at Palmetto High. I don't know that we've heard anything from Palmetto or Braden River. Are you from one of those?
Southeast, and band is good. So.
Right. So
It can be done.
it can be done. What I'm saying is we need to get the assistance also of the schools that have done it, and I know the gentleman in the back has also offered his assistance too, so that we can help those to make it happen. And like you had stated, we can do these programs very safe, and not just chorus or band, but vocational things. We have to be compliant. We've got to make sure we're following CDC guidelines. So my commitment, and I know it's short, I ask that you give the schools some patience, and my commitment is to go help. Some of the schools do have an increase of numbers this far above their projection. Not Southeast, but Manatee has a little bit above. So let me see also how can I give a unit split some. We're not using many of our virtual needs through Manatee Virtual. That's how Mr. Sauer is able to help and pick up some of these isolated things. So there's a little bit of flexibility that we can assist one another. It might not all be 100% great by Monday, but I do think we can make an improvement in the areas that we're seeing some difficulty, and I am committed to do whatever we can to help with that situation and to help the administrators. But please note, they've been working tirelessly. They're trying to figure it out, and it really is like a jigsaw puzzle. I just happen to be one of those people that my degree was in mathematics. I could solve a master schedule pretty quickly. I could see things that way quickly. It's not easy and quick for everybody. 2 weeks has been a very, very short turnaround for many, but we can make some improvements. And I do appreciate the voices of concern by alerting us so that we can go out and help make it better. And Southeast, I appreciate you being here stating that it can happen, just like you heard from Jeremiah earlier today. So it can.
Thank you. I hope that we can get there together. I truly do. And I hope, and I would expect that there will be support and help to get us there. Reverend Golden, I see that you hit your speaker button.
Yes, I did. Madam Superintendent, you've been listening tonight at the public comments. Is there anything that you've heard tonight that you were not aware of, or that you had not become appreciative of having to deal with this coming year? Is there anything that has come up here that you had not dealt with this time last year, tonight for the first time?
Everything about the next school year has been daunting, from face shields to face masks to PPE to master scheduling to state possible budget cuts that obviously are looming in the November time. It's been very challenging, and I have to say that I believe all the parties in the district and the school sites, all of the individuals that work for this district have worked tirelessly and been dedicated to ensure the best possible education for our children under unbelievable circumstances. Still committed, still trying to make it happen, and doing whatever they can to see it through.
Madam Chair, it seems, just from all the communications that we're getting, that what we are called upon to do is to deal with a new school year that we've never seen before, under circumstances that we've never experienced before. And so, I don't know, I think that we need, because I don't understand modalities and all, that doesn't mean anything to me. I'm not an educator. I know you all know all of that, and you know what that means. But what I hear are parents hurting because their children won't be able to have the experience that they had last year. That's what I hear. My child will not have the same experience this year that my child had last year. And there's a reason for that. And I wanna hear from the people who are in charge of trying to make this year as close to last year as possible. So I'd like to, I don't know, a workshop, I'm just not quite so sure.
You're just jumping ahead. The next item is workshop item requests.
Oh, okay, I'm sorry. I apologize. It's late, isn't it? But I'm hearing it, and it's, you know, it's like, I'm almost getting the feeling that we're doing something intentionally or negligently that we haven't considered, that we haven't looked at, that we haven't tried to deal with, and that's a frustrating feeling. I feel helpless. Yes, and so I'll wait till the workshop time comes, because I really want to find out what a modality is.
So I'm on to workshop item requests.
Okay, then I would like to address that we have a workshop toward the end of the first, what do you call that thing where we, the first,
Quarter?
Quarter or
no,
semester?
no, for the funding, for the dollars.
Survey.
What, the survey, the head count? Yeah.
In October, which is close to the
Yeah.
end of the first quarter.
Yeah, I would like everybody to just step back, take a deep breath, and appreciate that none of us have been here before. None of us. Not you, not any of us. And come together formally and specifically and particularly at one time for one reason only, to try to address the problems that we know that we now have. Because everybody has an idea about what's best. And none of us have been here before. I don't care how much experience you've had, where you've been, who all you've been before, and no matter how great you were, what the last place you were, you haven't been here, not now. And I just think we're getting all excited over something that none of us have experienced at a time when all of us need to be trying to cooperate with each other, not trying to cast blame. So I want that to become a priority workshop for us. What was that you all said? The first
Survey 2, which is it's usually.
It generally falls close to the end of Q1.
Okay, and that will be September, October?
October usually, yeah.
October, yeah. Yeah, so maybe we can get a bigger forum and get a bigger place and let people know what we have now experienced. Because I've said this before, we are talking about opening schools like this is something we've done before. We've never done this before. The last time we opened schools, we thought we were going to have kids to graduate in May. That didn't happen. And we've never opened schools like this before. And so I want I want to have that work. I want to hear what the results are from what we have done in this county to try to help this kid who is a student, and to help all these families that are coming here asking. We don't know. Let's just be honest. We do not know. But we're doing the best we can. I'd like to think. We're doing the best we can. We you know, and we'll see. That's all. I know one thing. I know we're not going to quit. I know we're not going to give up. I know we're not going to just throw up our hands and turn around and walk away. Nobody's doing that. And if anybody has a good suggestion, a good idea, I don't know anybody on this board that nobody would listen to.
I do.
Do you know somebody on the board that nobody would listen to?
I'm kidding.
Oh, yeah. Yeah, okay. That's fine. It's just, everybody's just getting all upset and antagonistic toward it. You know, that doesn't help. And you know, this chairman, this chairperson that we have here has two. She's the only one up here got children in the school system. Only one. And we talk. People come up here and they well, you all don't know what you're doing. I mean, that's not even nice. That's not kind. So I beg you, make that a priority. Keep track of what has gone wrong that we tried to fix. Because I agree, people shouldn't be this afraid. Shouldn't be this afraid. Shouldn't be this angry. Shouldn't be that way. Then that's my comment. I'm done. I don't want to have anything else to say for the rest of the night.
I will hold you to that.
Yeah. Okay. No, that's fine. That's fine. I've said enough.
Are there any other workshop item requests? Mr. Minor.
Well, Madam Chair, I would appreciate the opportunity to comment with respect to what we've heard tonight.
Well, we're going to have board comments later. Can we just move our way through this and then we will get there? We're not that far away from getting there.
Okay, I feel this is the moment. I think this is the moment because, you know, if the chair is ruling, but I think, you know, we've heard comments, you know, from our Reverend Golden.
He did actually request an item for a workshop. Granted, he did elaborate, and this is even more elaboration. I don't want to elaborate any more than I need to elaborate. I just want to, let's just get there.
Okay, we'll proceed.
Okay. Are there any other workshop item requests? Legal update. I like that. Instructional update. Janelle Yost with us? No. Operations update.
Absolutely. Madam Chair, good evening. Thank you for giving me an opportunity. I just have 8 items, but I think they're important. I want to just talk about, the purchasing department, the warehouse, delivery, what's happening out, what is the operations department doing to help out some of our sites get opening. Face covering. So we've received 293,000. You can imagine that, 293,000 free masks from the state and federal. We've issued out 221,000 to our contract, charter, and district schools. We currently have 71,000 masks in our inventory and are available for the district schools to order. In addition, schools have ordered another 30,000 masks. You saw some of them here tonight, where they're branding them with their own logo from the school on it. District received another 5,000 masks earlier in the summer. We've received almost 90,000 disposable masks. 46,000 have been issued to the schools and department. We still have 43,000 disposable masks in inventory and available for schools. Face shields, we have 12,000 face shields ordered and received. Partitions, almost 9,000 partitions are being deployed by the end of this week. Other PPE, gloves, 52,000 gloves have been issued out to the schools and department. We have 140,000 gloves due into the warehouse on Wednesday, and an additional 140,000 gloves by the end of the month. We've got sanitizing supplies. Number 4, the warehouse received 9,728 gallons of hand sanitizers. We've issued out almost 3,000 to the schools and departments. We have almost 7,000 gallons available in inventory for the schools to order. In addition, schools have ordered many other hand sanitizing products themselves besides just what's stocked in the warehouse. Wipes, 1,250 cases of canister wipes were received, but they were replaced. The active ingredient was not correct from the vendor. The vendor's making good on it, and the shipping a replacement product on 8/13 with the alcohol which is needed. We also have buckets of wipes coming. They're scheduled to be delivered by the end of the month. That's 28, almost 3,000 buckets. Proxy HD custodial service went ahead and purchased that product for each classroom. They're being delivered to the classrooms. Going forward, we are going to stock this product in our warehouse. Anti-bac soap, we have over 5,000 refills of soap have been issued out to the schools. 2,400 refills are available in inventory. Thermometers, hundreds of thermometers have been distributed out to our sites, and you're seeing some of the ones that we've tested out here and at other sites too that are the Gateway optical. In addition, we're allocating 52 new full-time 8-hour custodians out to our sites. That's going to be paid for by the Emergency CARES Act funding to help cleaning of our sites and our schools. Here's an interesting one, number 7. Food service. Food service this summer served 547,000 meals to our students. 500,000 meals, over 500,000 meals were served this summer. Our last record that we had in Manatee County was 210,000. So we more than doubled the number of meals that are served during the summer, this past summer. Last, there's many other departments not mentioned, whether it be construction, transportation, maintenance, HR, finance, payroll, safety and security, all the schools working together. I mean, everybody is working hard to get ready for this opening of the school year. And I just wanted to take a minute to thank everybody involved with the School District of Manatee County. So appreciate the time tonight. Thank you.
Thank you. I know how hard everybody is working. I appreciate it. Superintendent remarks.
Yes, I did want to make a comment about the Marauders and LECOM and the use of their facility for our first graduating class of 2020 in an outdoor baseball arena. They said we were the first experiencing any people being in a stadium in a professional or semi-professional venue under COVID. So they were using us also as determining how they would be able to maybe migrate further in the springtime with baseball. And I know we're all anxiously awaiting for that sense of normalcy to return. It was just very important for us, I know, in the schools and the children's family to provide that moment for them to just have closure and to say goodbye to their peers. They left for spring break and they never got to say anything to their whole class again. So it was just really an unbelievable experience, and we really appreciate the partnership we have with our community partners, because we would not have been able to pull it off without their support. In addition, another milestone with a partner or many partners is our community partnership school at Manatee Elementary. It will officially open Monday. So if you've driven by there recently, you'll notice 3 portables. Those outside portables are our clinic. We have 3, one for the community, one for mental health counseling, and the other for any medical needs. So I welcome you to go out and view that. I know they're looking to give tours. We'll have an official grand opening soon. But again, that's a huge partnership with University of South Florida, MCR Health. Many partners and community members have come in. This was a brainchild of Mr. Kennedy a few years ago, and it will be official. And we're able to launch it, and hopefully this will be one of very many more to follow. In addition, talking about medical support, we are trying to also establish an MOU with MCR Health for teledoc services for all students in our entire school district that may be in need of medical services that do not have a primary care doctor. We're hoping by Labor Day that agreement will be ready, and we'll bring that forward to the board and the community as well. But in a new thing, I know Mr. Wagner didn't mention it, but it is part of our operations. We are working collaboratively with the Department of Health for a district command center. I do believe it'll kind of be loosely put together and officially manned starting tomorrow, but it will be completely manned starting Monday. It is located on the 2nd floor of this building in room 215, but we will have, we've partnered, of course, with our local health department. We will have a full-time epidemiologist there. We will also have a full-time staff that works directly. They're an employee of the Department of Health, but they work and train our nurses in our schools that are employed also with the Department of Health. We will have our own communications team there, Mr. Barber, Kevin Chapman, who's hiding in the back. We will also have IT support, because we do have a tracking mechanism in place to determine if we have any COVID possible outbreaks or infections. If anyone in the schools have questions, we will be able to track students that are possibly infected and or any employee in a building, just so that we're able to manage it, clean it, communicate, and make sure all parties are aware. The Department of Health really is the overseer of the pandemic. They will make the decisions that we follow through with, but having them closely working hand in hand on our facility, at least for the few weeks of the beginning of the school year, I think is going to ease everybody's mind and make it more efficient. And our goal is to have all bugs worked out at all schools by Labor Day. So that's fingers crossed. If we can make it to Labor Day, I think the year will be bright. So with that, Chair Messenger, that's my update.
Thank you very much. Reverend Golden.
Thank you, Madam Chair.
Oh, I'm holding you to it. All right. Mr. Minor, you're up.
Thank you, Madam Chair. And these are the times that try men's souls, right? I think that the one thing that in our souls we can be grateful for is that we have a superintendent who is unusual in her abilities for dealing with schedules. And I have no doubt she has been working triple overtime to try to put together a very difficult, some would say almost impossible, scheduling to serve this community, serve our schools. One of the questions about the modalities, the three modalities of education that in our public schools are those who are going to be full-time brick and mortar, those who are going to be e-learners, and those who are going to be hybrid. All require different teaching modalities, maybe different teachers, different skills, different money, and trying to blend them in a way that goes into a schedule of a teacher's schedule, and asking teachers to really do three things is something never before been done here, or I think anywhere. There isn't a playbook on that. It's a supreme challenge that is being engaged by our superintendent. I think we will never fully appreciate what she is doing. What I hope is that what I picked up from earlier comments, by her about Braden River somehow as to the skill of their principal, and our superintendent has been able to make it work there in terms of scheduling, and I understand from our superintendent, from her comments tonight, that she's working very hard to have our other high schools meet that level of performance in their scheduling. We cannot allow, as a casualty, of these triple modalities, which this board approved, to be a destructive force. And what we heard tonight from educators of the importance of programs that have been developed over many years in the arts, in the VOTEC, be it band or chorus or other fine arts in performance, which this district excels in, and our high schools excel in, and have an effect upon the students, not just of pride, but learning from those experiences. We cannot allow the adoption of this board by three modalities to kill off what has been built up over many years by highly dedicated teachers and schools. That's not something, and we've heard from great people here, great teachers, of the importance of it, and we can't let it go. If you let it go for 1 year, as we've heard from some speakers, it's gone. They have to remain. And I infer from the superintendent's comments earlier that Braden River, through intellect, through imagination, and a lot of work has pulled it together, and by gum, there's no good reason, no sound or acceptable reason why every other high school can't do that. Needs to do it, should do that. We have great principals at all those places, and I understand this challenge has never been encountered before. But these other high schools also have the advantage of a superintendent, a math major who knows how to pull things together to preserve these programs. This idea of generic music is nonsense. You know, generic performance arts, nonsense. You know, generic band? No, we have the best band in the state of Florida right now, and it's nothing like generic, or generic music, whatever. And the rationalization that, you know, we just had to adapt, I don't buy that, and I don't think anybody buys that. We have to have those programs. And I'm sure we're going to get that because we are blessed with a superintendent, and it's going to take some work of principals and those who are involved with, you know, the scheduling, and they're going to make it work. You know, our district depends upon that. Careers depend upon that. So that's the challenge of modalities that this board has adopted, and how we're going to somehow make that work. I have confidence our superintendent's going to do that. And the very dedicated people who have spoken here tonight, I hear their cries. I think everyone hears those cries. But their superintendent has my full support, and I think the rest of the board, to make that work. It's a lot of work, and it's in the next few days, I think we're going to hear about those accomplishments and bringing everything together. Those are my words. Thank you for allowing me to share them.
Thank you. Dr. Hopes, are you still on?
I am. Thank you, Madam Chair. It was good to hear our teachers come forward. I'm concerned that there has been a communication gap. And I'll first start with the modalities. According to the CDC, the risk levels are this. E-learning is the lowest risk. Basically, our hybrid is more risk, and 5 days brick and mortar is the highest risk. Along with that, if you recall our board meeting and workshop with the health department, I asked a very direct question to Dr. Bensey. If we are able to keep students in cohorts, would that be helpful? And if you recall her response, yes, absolutely, it would be helpful. We had that discussion before the CDC finalized their guidance for reopening schools. And one of the sections in reopening schools, if you are not going to do all e-learning, is identifying small groups and keeping them together, and in parentheses, brackets, cohorting. That is easier to do in the elementary schools. The reason for cohorting is when you get the inevitable case, you merely have to quarantine a class. If you keep the staff and the students together in a small cohort, it's easier in elementary school. The superintendent and we have been looking at how you can do that in middle school and high school. What apparently has not been communicated to the middle schools and high schools is the complexity, as discussed by the union, Pat Barber, and the superintendent, with all of the various electives we have, in being able to reduce the student cohorts so that we don't have students going all over campus, and we're able to keep cohorts together in the middle schools and high schools. So when there is a case, and there will be a case, we merely have to quarantine a cohort of students, not shut down the entire school. And so that is one of the factors that I believe the superintendent and her team have been working on, is how do we create an environment where when we have the inevitable case, we don't have to shut down an entire high school or an entire middle school. And that is, that is the facts. This is a temporary situation. It's doubtful we're going to have to live with this forever. What I heard from some of our educators in the performing arts is that this is just the beginning. Once you do this, you're gonna end it, and it's gonna go away. This board and this district, long before I was on the board, has been one of the leaders in the state in offering the liberal and in offering performing and visual arts, and that's going to continue. One thing that wasn't in the interview last night on the news was that I mentioned clearly that Watchdog Miner and I both played the trumpet in school, and we believe in music. I started playing the cornet in band and orchestra in the first grade in public school and continued throughout my public schooling years. And so I hope that our education, I understand, because of the challenges of working through these schedules and trying to minimize student movement across the campuses for those parents who chose the highest risk, which is the 5 days in our schools, that what we are trying to do is to minimize that risk. With regards to certain subjects, choir, band, it's clear you cannot share instruments. It's very difficult to disinfect instruments. A case published by the CDC in the Morbidity and Mortality Weekly on May 15th, a case that was written up on May 12th, dealt specifically with choir practice and 61 individuals in a choir practice, where there was one case. And that one case, in that one choir practice, infected 52 people. There was an attack rate of 53.3% to 86.7%, and the contributing factor, along with them in a group and not being distances 6 feet or more, was the mere fact that they were singing contributed to how the super spreader was able to infect an entire group of people. So there are certain things that we may not be able, courses that we may not be able to do safely during this temporary period where we are providing our parents and our students with the option of coming back to school. And so I hope that the public is patient, as the superintendent has said, that we are going to work through this. This school board in this district is committed to the excellence that we've achieved in the visual and performing arts. It's not going to go away. It may look different in the first quarter because regardless, we have to follow CDC guidelines. And anybody who can give reasonable thought to how this disease is spread should be able to understand why there are certain activities that should not be practiced when we are running the risk of spreading a disease throughout an entire school and the community. And so I appreciate all the input, but our superintendent and our administrators don't deserve some of the attacks and misinformation that was directed at them. Everybody is working hard. We're all in this together. We are trying to open schools safely and, more importantly, maintain open schools throughout this pandemic. As Reverend Golden mentioned, nobody that I'm aware of has dealt with anything like this. The world has not seen a pandemic like this in over 100 years. In over a century, the world has not had to deal with a situation. We're not going to be able to open schools like we did last year. As Reverend Golden said, when we opened schools last year, we were planning on graduation in May. We had graduation in late July or August. So we're not going to be able to function like we did last year. We are in a pandemic that the world has not seen in more than a century. And we're all in this together, and we want the best for the children of Manatee County. And I just ask the public that you bear with us. We are all working tirelessly to serve the children of Manatee County. And because we may have to make a change now, do not let the fear of this school board, as long as these members are on it, don't allow a fear of us minimizing or destroying the gains that we have achieved and been recognized for in the visual and performing arts. Please, please give us the time and the opportunity to do the best that we can do and follow CDC guidelines, ensuring that our schools are open safely and we can continue to keep them open for our children and for the community. Thank you, Madam Chair.
Thank you. Vice Chair Kennedy?
Thanks. I feel like I'm in the twilight zone a little bit because, and this is the last I will say about this, and then I'll try to let it go. But we are embarking on a path that there's just so much uncertainty, education-wise, health-wise, and even Richard Corcoran, who thoroughly dislikes public schools. I watched a press conference he did this week with the governor. He can't even bring himself to say the word school boards. He refers to us as locals. He said it over and over again. Even he has said, you have until August 31st, and yet we are going to push ahead with this and show up at school 2 weeks early outside of the Florida chapter of the American Academy for Pediatrics guidance. And I realize I have lost this battle, and I will, after I've had some time, or maybe I just need a night's sleep, and I will let it go. But I never thought I'd be sitting here a month ago, but I am. So the Community Partnership School, Superintendent Saunders, I appreciate the update, and I appreciate the kind words for me, but I've said this before, but this was not my brainchild. This was a brainchild of the community who brought it to me, and then I brought it to the board and to you, and you made it happen. So thank you for that. I don't want to end on, as was said at the home go that the superintendent and I attended last Friday, I want this to be a positive note and not a moment of sadness, but I'm not sure what camera I'm on, but where am I? Anyway, this young man, we all know and heard about when we heard about the death of a 17-year-old in Manatee County. And this young man's name is Samarian Green. He went by Mari. And thanks, Nick, for zooming in. Here's a more recent picture of Mari. And the superintendent and I were lucky enough to be invited to present Mari's diploma to him posthumously, because unfortunately he passed due to COVID. And Mari had been a student of the district. He hadn't been in a couple of years, but and obviously I never knew this young man, but his service for him was really an amazing thing to experience because it was an uplifting and positive experience. And one of his cousins told a story. Mari was raised by his mother and his cousins, essentially, and he had CP, so he required, he required medical attention. And his cousin, and I apologize that I'm forgetting his name, but he told a story about his other cousin who goes by Turbo. And he told a story about how Turbo saved Mari's life one day. And it was just really, clearly Mari lived only for 17 years, but he lived quite a life and surrounded by people who loved him. And he has, there's pictures on the back too, but he had quite a smile. And on his service here, it says his nickname was Fat Daddy. So Mari, rest in peace. And In addition, unfortunately, I found out yesterday that a Manatee County School District legend has passed away. And speaking of Manatee L, I never knew Ozell Ackerman, but I know his name because it's above the auditorium at Manatee Elementary School. And so I got a couple texts, then I jumped onto social media and saw some of the tributes that were there. So I didn't want to let this meeting go by without a mention of Mr. Ackerman, because I know a lot of people in the district who have been around here a lot longer than I have know Mr. Ackerman very well. And I just figured I would finish with a mention and a tribute to those two. And Madam Chair, that's it for me. Thanks a lot.
All right. Well, I think I'm all talked out. It is 11:16 p.m., y'all. And I am going to adjourn our meeting if there's no further. Nope, nobody's arguing with me. All right. 11:17. Thank you.